Well, welcome everyone. We're so excited to have you here and would love, given that this is such a large group, would love for you to individually introduce yourself to one another using the chat. My name is Erin Courier. I'm a program officer at the Kellogg Foundation and a proud co-chair of the Care Fund. Just a note for everyone that we are recording this meeting because we want to be able to share it with our colleagues who are missing and unable to attend, and make sure that they also can learn about some of the fund's work with grantees and other colleagues. So again, welcome to the Care Fund's June 2021 Learning Meeting. This is meant to be an opportunity for both donors and grantee partners to come together during what is a completely unprecedented time. There is major opportunity and significant potential to transform our country's care infrastructure. For those who are less familiar, we want to quickly introduce the Care Fund, which is inspired by our grantees to really seize this historic moment. We launched the Care for All with Respect and Equity Fund to vastly expand and align philanthropic resources behind the movement for a universal, publicly supported care infrastructure. The funders around the table are quite diverse, but they share a set of values that are reflected in the fund's name. And if you give me 1 minute, I'm going to share our website so that you can see all of that. Hold on 1 second. There we go. So as you see, this fund believes in care for all. We value and amplify the voices and leadership of everyone who is giving and receiving care. And that includes family caregivers, care consumers, and professionals who work in early care and education, long-term services and supports. We believe that a universal high-quality care infrastructure will support families' economic security and create a thriving and sustainable economy for all of us. Respect. We deeply respect the primarily women and women of color who work in early care and education, long-term services and supports. We believe that they deserve living wages and benefits. And we know that improving the quality of jobs will directly improve the quality of care that children, older adults, and people with disabilities will receive and that they deserve to thrive and live with dignity. And equity. We believe that an equitable care economy will undo legacies of racism, slavery, xenophobia, sexism, ageism, and ableism. That's a lot of isms. But our fund is very much rooted in the recognition that our history and legacy of slavery contributes directly to the way that care is undervalued and underpaid now. We believe that we must ensure care systems and services create good jobs and provide high quality, universally affordable and accessible benefits. Anna Wadia is going to share more information about our grantee partners, but I also wanted to recognize our funder partners who have come together to work on all aspects of care infrastructure under this one holistic frame, including long-term services and support, childcare and early childhood education, paid leave, worker dignity, and rights. They are the Ford Foundation, Heising Simons, Perigee Fund, Pivotal Ventures, Robert Wood Johnson Foundation, Schusterman Family Philanthropies, and the W.K. Kellogg Foundation. For our agenda today, we're going to start with an opening plenary where we hope everyone can hear from a few of our incredible, powerful movement leaders on the current policy work to achieve care infrastructure and really give us all a chance to understand what is happening right now, what is on the horizon, and what is the vision that we're working towards, and what do we all need to do to get there. Next, we're going to move into one of 4 breakout groups that look at some of the specific strategies to achieve transformative change. including federal policy advocacy, state to national organizing, communications and narrative work, and state and local implementation. These are meant to be open, dynamic discussions between all participants, but each session will have the Care Fund's grantee partners who can serve as resource people to help shape the discussion. Please note that this is a C3 space. Discussions on legislative and electoral issues are for context only. So at this point, we're going to go through an exercise to introduce ourselves. In this virtual audience, we're really lucky to welcome almost all of the Care Fund's grantee partners, as well as all of our own funder partners. And we're also joined by many other foundations with whom we have discussed care infrastructure funding and the importance of working across the care continuum. So again, thank you to everyone for making the time to join us today. Since we don't have time to do a full go around, hopefully everyone has put their name and their organization in the chat, and there will be more time for thorough introductions during our breakouts. But at this moment, we're going to pair up in groups of 2 so that everyone can make a connection with at least one other person. And in your pairs, please say your name and your institution, and just take 2 to 3 minutes to share a story about an intergenerational moment when either you or someone you are close to connected with someone else of a different generation and what you observed or felt or realized.
I think, Matt, if you could zoom us to the different pairs.
There we go. All right. Excellent.
Welcome back,
I think we're all back. Great. Welcome back, everyone. I know I had a great short conversation and hope that everyone else enjoyed a few minutes to connect one-on-one. You know, it really makes me wish we could do these sessions in person, and I'm looking forward to the time where we can, so that we can really all get to know each other on a deeper level. So my name is Anna Wadia, and I am a program officer in the Ford Foundation in the Future of Workers program, and also very proud to be co-chair of the Care for All with Respect and Equity Fund, along with Erin Courier from the Kellogg Foundation, who you just heard from, and Brooke Kelly Green from Schusterman Family Philanthropies. When we started the Care Fund earlier this year, when there were actually just a few funders around the table, we knew that the moment was now and we couldn't wait. And given the historic opportunities presented by the new administration and the composition of Congress, we decided to make $2.5 million in rapid response grants for federally facing organizing and advocacy. We supported 3 different types of efforts with these grants. The first are coalitions and tables. These are working both within movements like paid leave and across movements. And they're really bringing more strategic alignment to these fields than I've ever seen. And I've been in this work for a long time. We also thought it was really important to make sure that the lived experiences of diverse communities are driving narrative change and federal policy reforms. So we supported a group of movement networks that are really bringing up these voices from the state and local level. And then finally, even though aging and disability groups are part of many of these tables, their voices aren't always as prominent. And so we made a special point of making specific grants to a set of organizations working on aging and disability rights. Next slide. These grantees are building broad-based movements that cut across the whole continuum of care. And this is really what we feel is particularly unique about the Care Fund, that the groups work on paid leave, long-term services and support, early care and education, and improving the jobs of workers in these sectors. And again, both going deep into some of these specific issue areas, but also, as you can see from this Venn diagram, working at all of the different intersections. So we're thrilled that representatives from almost all of these organizations who have received rapid response grants from the Care Fund have been able to join us today to share their analysis of where we are right now, their learnings, and help us look towards the future. We couldn't have a better set of advocates and organizers to ground us this afternoon in the opportunities and challenges of the current moment. We're joined today by Ai-jen Hu, who directs both the National Domestic Workers Alliance and Caring Across Generations, Natalie Keene, who is the Senior Staff Attorney for Justice and Aging, Nicole Jorwick, the Senior Executive Officer of Policy at the ARC, and Sade Mumsami, Interim Executive Director at Family Values at Work. We will have a discussion until about 2 p.m., and then we'll open it up for your questions. You can either write your questions in the chat as the discussion is going on, or just write stack in the chat and I'll call on you when we get to the question and answer session. We also know that several of you who are specifically interested in federal policy advocacy have already signed up for the small group discussion on that topic, so that is also an opportunity where you can go deeper. So we thought we would start by giving our panelists a moment to introduce themselves and their organizations. And we also asked them to share what has inspired them to do this work. So, so let's start with you, Nicole, and then we'll move on to Ai-jen, Natalie, and Sade.
Great, thanks so much, Anna, and thanks so much everyone for being here and for being part of the Care Fund. My name is Nicole Jorwick, and I'm the SEO of Policy at the ARC of the United States. For folks that are not familiar, the ARC, our organization, the mission of which is to promote and protect the civil rights of people with disabilities and their family caregivers, as well as support the paid direct care workforce. Our organization has over 600 chapters in every state. We have state chapters in over 40, and a good percentage provide direct services to people with disabilities and their families. And all are focused on advocacy, either individual advocacy, state level advocacy, or systems advocacy, and all of them engage in our federal work. The ARC was founded over 70 years ago by families like mine. I was inspired to do this work because of my brother Chris, who actually I was thinking might be here because I'm in at my parents' right now, but he's away, and unfortunately right now he's with my aunt because something that we deal with on a personal level is the workforce crisis when it comes to supporting people with disabilities and aging adults. And since my brother's most recent direct care worker left for a better paying job, that's a demoralizing phone call to get when you're in the middle of working on legislation to fix the problem. But it's the passion that drives me to do the work that I do, and really glad to be here today with all of you and with this amazing panel of amazing humans.
Thanks so much, Nicole. Jen?
Yes, I was going to introduce myself as the president of the Nicole Jorwick fan club. And I'm also the director of Caring Across Generations, which is a campaign that was launched in 2010, a decade ago, by Sarita Gupta, who's also here, and me and our organizations, to change the way that we value caregiving in our culture and in our policy in this country. And my colleague Diane Russ-Tierney, our Director of Advocacy, is also on today. We were really proud to help launch Care Can't Wait this year with so many of my amazing colleagues who are on this call. I'm seeing all of you, to help realize the promise of this moment on care. I'm also the director of the National Domestic Workers Alliance, which works to achieve fairness and quality work for the workers, mostly women of color, who work inside of our homes, providing caregiving and cleaning services. And I would say that my inspiration comes from my mother and my grandmother, who were my caregivers, and all of the caregivers in our movement who truly make everything else possible. And just to say thank you, Anna, this moment and this Zoom screen feels very historic also, that we're all coming together in this way.
Thank you so much, Jen. Natalie, would you like to introduce yourself?
Sure, thank you. Thanks for having me. Thanks everyone for being here. I'm Natalie Keene, she, her pronouns, and I'm a senior staff attorney on Justice and Aging's healthcare team. Justice and Aging uses the power of law to fight senior poverty and secure access to healthcare, long-term services and supports, and economic security for older adults. And we have a particular focus on those who have been most marginalized and excluded from justice, and that includes women, people of color, immigrants, people with limited English proficiency, people with disabilities, and LGBTQ older adults. And I'm so inspired by all the people around me, but I really came to this work because I love Medicaid. I'm a huge Medicaid nerd, and as I got in learning more and more about the program and realizing how Medicaid really is our only long-term services and supports system, and that it's so hard and so complicated, and in aging especially, we're asking people to navigate this complex and underfunded system at the most stressful moments of their lives. And so I'm really inspired to change that and to put equity at the center as we do that.
Thank you, Natalie. Sade?
Good morning, everyone. Sade Moonsami, she, her pronouns, with Family Values at Work. We are a national organization of 27 states fighting on the ground for economic justice issues. After getting off the call with organizers this morning, and as an organizer myself for over 20 years, I am inspired every day by the day in, day out organizing that is happening on the ground. So many of our organizers who had COVID themselves this year, and that continued to fight through, and that continued to, who are single moms, and every day is dedicated to this work. Like, this is why I stand for them, and why I stand for movement building. And the time is now for us to take these actions and really see some type of federal change. And so every day I'm inspired by their work and what it means for like my own community back home in Brooklyn, what it means for my community of us who are first generations, for my other queer moms out here who are often left out of these policies, and that we can organize around this and make sure that we are included. So excited for this conversation today, and to be with so many of my colleagues.
Thank you so much, Sade. You know, as many of you said, this is a historic moment. Some have called it a generational moment for the CARE agenda. So would you be able to share with us what you see as the key opportunities right now to move this agenda? And Sade, let's keep you on and start with you.
Yeah, I think one, the showing of all the faces that are on this call right now is really a testament to what this moment looks like. And we really have this confluence of like 5 major factors at play that are going to be key to moving this movement forward. One, we have an administration that's committed to childcare and paid leave, to home and community-based service, and really looking at the full care infrastructure package. With the American Jobs Plan and American Family Plan moving, we have a vision on what we need to commit to in this country and finally move forward. Seeing the proposals for the $450 billion for child care and early learning and the $225 for paid family leave, as well as the $400 billion for home care, we know that there is dedicated funding and relief that can be on the way. Do we need to push for some higher numbers? That's some of the work that we need to do right now, and making sure those equity provisions, also the work we need to do right now, but really seeing an administration that we can work with and being in conversation with them to push these plans forward is one of the major factors. The second is the care champions that are in Congress and generally supportive across parties, looking at the chairs of the Help Committee and Senate leadership, and looking at some of our long-term champions on paid leave, including Rep. DeLauro and Senator Gillibrand, really pushing through what we need to see on the policy level in terms of having true care champions in this moment and pushing forward the narrative. Third, which maybe I should have put first, is the fact that we are all committed as advocates and organizers and coalitions. And it has been great to really work across with several of the partners on this plenary of what a care infrastructure looks like and putting all of our energy behind this moment. I think looking at the Child Care for Every Family's table, paid leave, the Care Can't Wait table, and being able to develop coordinated strategies in this moment has been key to really pushing this message forward. I think when we started the fight for $50 billion for childcare last year with lots of late nights, we weren't sure where we were going to land, and we stood hard in that fight. I think the other thing is really seeing the change in public narrative. In our breakout just now, Erin and I was like, you know, we said we won't go back to normal, and it's our time and opportunity right now to fight for not going back to normal of what it was before the pandemic, but moving forward a platform that really reverses the devaluation of workers in this country. And so really changing that public opinion and that public narrative. And then the fifth thing that's going to be critical is funding the movement right now and having funders that are really interested in understanding what movement building looks like, what advocacy is going to look like, and what states really want to support on the ground right now. So I think this confluence of all 5 of these is really what we're going to see push this agenda forward.
Absolutely, absolutely. Jen, would you like to jump in with kind of your take on some of the most recent federal developments?
Sure. I'll just kind of build off of Sade for a moment to say that I do think underneath all of these breakthroughs that Sade named is just the reality that there was like a foundational or core narrative about care, which is that it's kind of an individual personal responsibility to be shouldered by individuals, mostly women, inside of our homes. And that if you can't figure it out, you can't afford it or manage it, it's your fault. It's your personal failure. And I think what the pandemic opened up was the ability for all of us to collectively see the need for real infrastructure, that we're all just doing our very, very best, and it's not enough. We need to be investing in care as a public good with policy, with funding, with a workforce that is strong enough to support us. And that underneath, like that big shift is what we're trying to kind of cement and also cement with policy breakthroughs, but also with a whole bunch of other work that's happening across the ecosystem. In terms of what's happening right now, I think we're at a really important moment where there's been a bipartisan deal, so to speak, on infrastructure, where there is going to be a piece of infrastructure investments that are going to move forward in a bipartisan way. Simultaneous to that, so there's two tracks of work that are happening on economic kind of rebuilding and recovery. Simultaneous to that, Congress is working on a budget proposal that will include many pieces of the CARE agenda. It will include home and community-based services. It will include childcare investments and child tax credit. It will include paid family and medical leave. And as of now, the first version that we've seen does include all of those pieces. And the fight is to make sure that it stays in and stays as robust as possible. Both so that we don't get traded in the horse trading that happens, right, in such a big, like, expansive budget plan, and also so that the investments are meaningful enough to create the building blocks of the care infrastructure that we need in order to have an equitable economic rebuilding process. And so that is the challenge that this group is like on 1,000 Zooms per day working through, trying to figure out but two tracks are moving. The fact that this bipartisan infrastructure bill has been, or deal has been reached, is not a bad thing necessarily, right? We have to keep both tracks moving and have to make sure that care stays in.
That's really great to hear. And Nicole, of course, you are in this day in and day out. So what do you see as the key opportunities right now, and especially with your focus on home and community-based services?
Yeah, I mean, I do think that we're in this really unique moment. The momentum has been building around these issues, and frankly, a lot of that momentum is based in the threats that have been going on for the past several years. But because of those threats and having to do a lot of education and a lot of rallying on the Hill and within the communities that rely on all of these services, there's a greater understanding on the need to address the issues and the need to address the fundamental systemic issues that have led to a lot of these problems. We always say we wouldn't build the system that we have today if we were to rebuild it today. So now we just have to fix it. The media and general public understanding is also growing, but we have a long way to go in general public understanding, but continue to chip away. And also right now is kind of a unique time, not only because of the administrative support and the focus that we are seeing from the Hill on a lot of these issues, thankfully so, finally, but also a lot of the need has been displayed and put on display by the pandemic. COVID revealed things that the disability and aging communities have known for decades, including the dangerous nature of large congregate settings like nursing homes and institutions. And I have to mention that institutions are still open in 36 states. A lot of people think that after like the Geraldo Rivera, Willowbrook thing from the 90s that they're all gone, but they're still there and they're still taking a lot of money. And that's where we saw a lot of people unfortunately pass away during the pandemic. The size of the waiting list for services all over the country is being seen and understood, and the over-reliance on unpaid family caregivers, as well as the decades of lack of investment in the workforce that provides these Medicaid-funded services, has really been exposed because of all the tragedies that occurred in the past 18 months. The over-reliance on unpaid family caregivers and the clear display of the essential nature of this workforce and the lack of pay, respect, and dignity for the workers is not unique to the disability community or aging groups or even HCBS. So we continue to find ways to connect with groups like some of these amazing groups on this call, and we are really finding that we're stronger together. And these foundational relationships will get us to the big wins and also carry us through the years and likely, frankly, decade plus of implementation that it's going to take at the federal level, at the state level, and at the local level in order to modernize and improve all of these systems across the care infrastructure.
Thank you, Nicole. Natalie, from the perspective of older Americans and aging justice, what are the key opportunities you see right now?
Yeah, thanks. I mean, so we know that older adults say that they want to age in place. We've had this phrase for a while now. But you know, we still see a lot of older adults entering nursing homes, too many barriers to receiving care at home. Sometimes they, you know, because someone's being discharged from the hospital and they need those services right away, they might go to a nursing home and be thinking that's going to be a temporary placement, but it ends up being long-term. And this is especially true for older adults of color, especially people with limited income and resources, LGBTQ older adults who don't may not have family and resources to rely on to fill the gaps. Older adults with Alzheimer's, we're really lacking infrastructure to care for them in the community. And so, you know, it's exciting to have this moment and this level of investment and a real commitment to thinking about the infrastructure of this system and building it to be more equitable with the people who don't have access right now front and center as we design it. And I think, as you mentioned, Anna, at the beginning, you know, this is generational. We think this is the most you know, transformative investment in aging infrastructure in decades, you know, probably since Medicare and Medicaid were passed. And it's a rare moment. And it's really exciting to be working with disability, aging, and labor on the HCBS piece. We've always all cared a lot about HCBS. Nicole and I have been in tons of meetings together for years. But now we have something to really rally around, and we're seeing groups, I mean, including justice and aging, this has become our #1 priority. And that's really exciting. And then to be at this bigger table thinking about care infrastructure, we especially know from the older adult perspective, thinking about older women aging into poverty, we need to provide them with childcare and access to paid leave in order to stop that cycle of poverty. And I think it's just a moment to do it big and lay the foundation. And if we do it right, we'll get to keep building on it.
Great. Yeah, that is such a key point about how this impacts women across their life cycles and across generations. Natalie, let's stay with you now to talk about, with so much going on, obviously, with all these opportunities, there are also challenges. So why don't you reflect on what you see as some of the biggest challenges, and what are some of the most important gaps and needs that you see in the field?
Yeah, so I'll touch on a couple of things that have already been mentioned. You know, I think ensuring that we get the policy right is definitely a challenge, because we have to make sure that we're really filling the gaps in access to home and community-based services. You know, it's not equal across states. It depends on where you live, how quickly you can access, whether you might be put on a waiting list. It depends on whether you're an older adult or a child or a young adult with a disability. So we need to make sure that we're filling in the gaps and really addressing the needs for all populations and in every state. And then I think also, as Nicole said, we still have a ways to go on the education piece. You know, we really need to be thinking about how, you know, if we find ways to ask people to talk about their caregiving stories, they can usually start to relate to HCBS. But a common misconception that we face in the aging space is around Medicare. A lot of people think that Medicare covers long-term services and supports, and it doesn't. And so we have to be working on that messaging all along the way. And but you know, storytelling, getting older adults themselves involved is really critical. We met Aline, who's an older adult living in Jacksonville, Florida, who shared her story about how she's been independent her whole life. She's not married and doesn't have family to rely on for support, but a few years ago, she had surgery and ended up losing the ability to walk. And she does have Medicaid HCBS she receives some personal care services and help with some chores and things she needs help with around the house that also helps her get out and enjoy her community. But sometimes she's left alone on the weekends. And that's because of this workforce shortage. So we really see like this deep connection. We need to expand and support the workforce in order to expand services and deliver higher quality services for people.
Great, great. Thank you. Sade, would you like to jump in?
Yes. You think by this point in Zoom technology, you'd remember to unmute. Sorry about that. So things that I think are like going well right now is definitely like organizing and movement building across the country, really being able to move organizers towards understanding the investment in care and states towards the investment in care. I think what has also gone well is that we've been able to win paid family and medical leave in 10 states, but without a national policy, we know too many of our families are still left out, and states who have passed paid family leave trying to figure out like what's going to be the standing of those laws once a national policy is being pushed. I think overall, you know, we have the 50 billion in COVID relief and American Rescue Plan dollars for childcare, but really tracking how that money is going to be equitably distributed in the states and really being able to track that data right now as the funding moves down. I feel like this time is so important, especially for working moms, and the ability to organize mothers and caregivers in this country. I think the latest numbers is that we're seeing close to 1.5 million fewer mothers in the workforce at this point in time, which is a hard hit to the progress we've made as women in this country to really be in the workforce and being able to bring those workers back, especially because many of these households in our country are led by women and led by single mothers. When we see this devastation to mothers in the workforce, we're going to see long-term impacts on families overall. I think a challenge we're facing is that we're under-resourced, and as congressional leadership is making budget choices, we may be pitted against climate, which is unfortunate. You know, we need to see all of these movements come together. And also in terms of like childcare funding. So states have now received some guidance on the spend down of funds. One of the like breaks is how do we show these lessons learned on the spend down of funds? How do we really look at the stories and the data that's being collected to share the impact of these in rural communities, in communities that are labeled as childcare deserts, for Black and Brown providers, especially for in-home care providers that did not see much of this money that came down. So these needs are really great. The policy proposals are expensive, but we know that the cost of this and the cost of continuously not to invest in these policies are going to be damaging to our future, as it has been to our past. I think right now, the urgency is great in the field. One, in terms of support for organizers. So that looks like language translation, that looks like really investing in comms right now and message testing, really investing in political consultants to support organizers in honing in on their strategy, and overall building the capacity of state groups to both be on the state level and to also be on the federal level to organize. We see many of our like organizing within the states, there's 2 or 3 people organizing that are paid organizers, that are using their car to organize, that are using their own money to fund meals and to fund language equity, and are getting paid little wages to be organizers in the field. And so in order to really make a robust impact right now, it's going to be to fund the field and to fund creative ways that we think about organizers and the resources that they need to push out this movement. I think some of the things that we've seen seen also is that many people were organizing digitally and were able to reach wider communities within rural communities or within communities they hadn't touched from their home base. And so now they're like, how do we maintain the lessons we learned through COVID on digital organizing to increase our impact, but also have organizers to do in-person organizing to the safest means possible? And so I think those are some of the needs that we're seeing right now and the challenges we're facing in the field.
Thanks, Sade. Nicole, what do you see as what's going well and what are the challenges and the gaps?
Yeah, I mean, so there's definitely been a lot of positive change in how people with disabilities and aging adults are perceived as valuable members of communities and as people that we need to be empowering versus kind of pushing aside or putting away. But there's always more to do. There's a lot more to do in centering the voice of people with disabilities and aging adults. We're obviously seeing a lot of, in terms of going well, more offices on the Hill are focused on these issues. And the opposition, I had originally thought of it as saying the opposition is getting quieter, but that's really not the case. Because actually, while the opposition has been quieted because of some of the horrendous things that happened, for example, in nursing facilities. So sometimes the biggest barriers that we have to real change is that some of those lobbies have a lot more money than us. I always joke that there's no such thing as big disability money. And so there's, a lot of those associations have been what has gotten in the way of this transformative change. And right now they've been greatly weakened because of some of those horrible things that happened, but they are going to come back. I already see the ads on CNN, and that's something that we're definitely facing. And so we really need to keep getting people engaged. And Natalie talked about the misconception that so many people have of Medicare or something else covering them when they might need these services. We really have to get people engaged before they need the services. Even within the disability community, understandably so, everything can be a fight. Getting the right education services are a fight. So you can't think about what your family member might need at 22, 25. We really have to do a better job of engaging, of organizing, to Sade's point, making sure that disability advocates at the state level are talking to childcare and paid leave advocates. All those things need to happen, but they're all really difficult. And we're also still really struggling to break through in the media, specifically the disability angle. There have been positive strides, but for example, there was a Big Time magazine article and it was fantastic, but the title was all about aging, even though the content wasn't. And we still need to do enough to raise up the disability level issues specifically. Obviously, I'm biased. And we still have the challenge of connecting to communities that might not know about the benefits available. Disproportionately, beneficiaries of Medicaid home and community-based services are white. That indicates that we must do a much better job of getting into communities of color and making sure that there's an understanding of the services that are available and that we're not seeing for example, over-reliance on unpaid family caregiving getting better in one community, but only getting worse in another. And so those are some of the challenges that we're facing, as well as some of the things that are going well in this moment.
Great. Jen, could you just wrap us on this question, reflecting on what's going well and the challenges, and also what you see as needed moving ahead?
Yeah. I mean, I don't think I can overstate really what is going well. Like, so many things, we are winning. We've been through so much to get to this point and made it through so many hoops. We got included in the Jobs and Families Plan. First, we were included in campaigning, then the Jobs and Families Plan. Now we're in the actual budget, and we're in the playoffs. It's amazing. And we're in the playoffs really on our terms that we seeded. The care infrastructure agenda includes childcare, paid family and medical leave, and home and community-based services. And it pays attention to the workforce front and center. That in and of itself is a big deal. It's in the core economic agenda. It's not some side nice to have, get to later kind of agenda. It's the core economic recovery agenda. It's a big deal that this is where we are right now, and every problem we have is a problem of our success so far. So I just wanted to say that. that said, we do have some playoffs, high stakes playoffs challenges. And I'm looking at Kristen thinking like, this is the drumbeat that Kristen has been kind of trying to lift up, which is that it's been challenging to translate the incredible work that Sade and others described into the kind of momentum that we need to communicate to members of Congress. There is, in this pandemic Zoom environment where we can't show up on the Hill, like a real problem with breaking through, both not just in the media, but also to really be able to express the level of support and engagement on the part of constituents to members of Congress who are making decisions right now. I think we're going to have an enormous challenge getting to 50 votes on the whole care agenda at scale, and keeping those votes together as these negotiations continue through budget reconciliation. I think time is not on our side. We've got to move and move quickly. The longer this agenda stalls, the harder it will be politically to move something robust. So we're all in a mad dash to make big things happen before August recess and to be able to equip members of Congress to go home with good news during August recess, as opposed to face down horrible attacks, which is also quite possible. So lots of challenges ahead, but these are all challenges of having one historic progress on the care agenda so far.
Thank you so much. Thank you, iJen, and everyone else. I'm seeing some questions pop up in the chat, so I think we will turn to our amazing group of participants here on this call and let them chime into the conversation. So I see Quyen Din in the stack, and please correct me if I haven't pronounced your name right. And just introduce yourself and then feel free to unmute and ask your question.
Great, thanks so much, Anna. My name is Quinn Din. I'm the Executive Director of CRAP, the Southeast Asia Resource Action Center. I had two quick questions. Y'all can feel free to take whichever one most inspires you. Or the first one is, Sade, you mentioned the challenge of connecting across movements. I'm really curious about what are some creative solutions that we have in terms of connecting with other movements, including the immigrant rights movement. That's a space I'm in a lot. And yet this is not a discussion I bring up a lot. So that was a question mark for me. And the other is just a clarification question. Nicole, you mentioned the opposition. I'm curious if you could talk a little bit more about like, what's the opposition? Who did it comprise of? Like a quick 1-minute summary. Thank you.
Sade, do you want to go first?
Yeah, I think one of the historic challenges of connecting across movements is that these issues have often been siloed. Like what's been so great about Care Can't Wait, and really us as national partners and state partners coming together is bridging this gap, which Black women who have been saying for years, like we are not a single issue community and you're not going to save it with a single solution. And as we continue to invest our resources and really open up, especially for funders, to not think about funding one issue, you're not funding just childcare or just disability, we are funding a care infrastructure issue. And we need to bring in all of those voices into this moment right now of like these is a combination of supports that our country needs to see, and breaking down those silos across issues, and really being able to fund the movement. Like as Nicole is dealing with people who are dealing with disability issues, they're dealing with paid leave issues, they're dealing with childcare issues. And the more we continue on either a national or funder level to split these issues up, it is just damaging to the field. When we build movements for organizers, it's not just that they're facing a paid leave issue and they should be talking about paid leave, it's that they are facing childcare issues, they are facing climate justice issues. When we have flooding within states and childcare centers are closed down, or when there is a hurricane in states, when we see the impacts of global warming in these issues, this is a childcare and paid leave issue. And really being able to connect those dots, that these are not separate. I know the other panelists may have some other points on that. Feel free to share.
if other folks want to jump in on that question.
From a practical standpoint, there's lots of overlapping leaders in these different tables. And we really try to create connective tissue and make sure that we're coordinating in a way that is about keeping the total amount for economic recovery big enough so that all of our movements can actually get the resources that they need to make real advances through this package. And it's really hard. It's really tough, but we're talking to each other, we're working together, we're really trying to make the connections and guard against the kind of Hunger Games kind of zero-sum dynamic that we're used to, and I think we're doing pretty good.
I second that. I think we're doing really good. And as to answer the question on opposition, on that specific point, I was talking about groups like, don't mind the name because it sounds like innocuous, but it's the Nursing Facility Association, which is ACA, the American
Healthcare Association.
Yeah, American Healthcare Association. So it sounds innocuous, but those are the ads on CNN that I was referencing, and trying to then get funding that we really need to build the alternative for nursing facilities, because that's something that's really important to kind of fundamentally think of, right? Is that these home and community-based services are the alternative to those settings. So that's what I meant. But also it's broader than that, because the opposition, I mean, what we know from what we fought in 2017 with the huge cuts that were being proposed to Medicaid is that Medicaid has a lot of opposition to it. That's obviously some of it's political and some of it isn't, because fundamentally we're talking about a program that is a federal and state partnership. It's called different things in different states. It's an anti-poverty program that keeps people with disabilities and aging adults poor in order to retain services that they need, and also keeps people who are providing those services making wages that they can't sustain a family. And so fundamentally, this is a program, though, that gets a lot of, it always ends up under attack. That's why we always know that we have to remain vigilant. When there was $1 trillion of cuts that were being proposed in 2017, they would want to have these conversations about modernizing the program. And we were like, we can't have those conversations when we're talking about cuts. So it's, when I'm talking about opposition, I'm talking about political opposition, probably number one, but there are also some associations and others that are not a fan of this huge investment because it puts their business model at risk.
Yeah, great. So Krista, I see that you had a question in the chat. Would you like to ask it to the panelists?
Yeah, thanks so much, Anna. And thanks to all of you for being here today and sharing your wisdom with us. Something that Nicole said reminded me around some of the tensions I have been picking up from some of my other grantees around the education and implementation space. A lot of times when we think about challenges in implementation or challenges around education, we focus on that first level, like, do people actually know about the benefits? And I'll offer, like, that is absolutely true, right? There's that first layer of outreach. But where I think we typically get stuck as progressives is continuing to do that, because that's easy to measure and it's easy to do. And what we don't start to think about are some of those bigger systemic things. Like, first of all, there are reasons why people don't know about things. And there are reasons why people who know about things don't use them anyway. And some of them are because the system does not work for me as it stands, which are really systemic issues. And they get hidden in things like that are provider shortages, which might be a shortage of providers, or might actually be, we actually don't have a workforce that's compensated well enough, which we know in the care infrastructure, or we continue to produce experts who don't have the skills that they need to do other than clinical treatment to engage with the populations that most need them. And so then they drop out of the workforce, right? It's systemic racism and sexism issues that we couch as shortages. So all of that preamble is to say, right, I'm a funder now. I used to work in nonprofit. Like, what are the things that funders should be thinking about from a funding perspective that gives nonprofits the space to think about and develop a plan of attack for addressing some of these more systemic challenges around access that make us really address those systemic issues in deeper ways?
I mean, I think that I can start us off, but other people probably have much wiser things to say. I mean, I think that when we're talking about that some of it is that I think we do kind of keep the conversation up here, right? We keep the conversation between funders and national organizations. I came from a state level background and working for a local service provider. And I think that sometimes we can get stuck because to your point about, you know, all of us can go and talk, but I can come in to talk to Illinois because it's a state I know. But if I go and get into the weeds in another state, I don't know the rural disparities, or I don't know some of the other historic things that might have happened in a city that are leading to some of the problems in terms of maybe special education teachers that can go into different communities, that sort of thing. And so I think that that's what I would love to see the CARE Fund and all of us continue to think about, is how can we make sure that all of this really good collaboration gets down to the ground? So, because I honestly don't know that we are the ones that even know the right questions, because I think we sometimes need to get down and ask them, not saying that, I mean, all of us end up in a bubble at some point, right? So I can speak for myself and say that. So I think the first question is, who do we need to be asking about why they aren't feeling reached out to or feeling like they know what they need?
I would also just add, I think for funders to reinforce the importance of engagement with like users of these programs, that we actually need to involve as early and as often as possible older people, family caregivers, people with disabilities, and the workers in the design of how we are imagining revamping these programs. And for funders to help echo that message, I think would be really helpful.
Yeah, I'll piggyback off of that. I think it's about how we're doing our outreach and how we're bringing people into these programs. It's not that people don't know that these issues exist. When I was out of work and having my child and had no money to feed her, I knew I needed WIC, and I had trusted messengers within the community that taught me how to navigate that process, and then became one of those trusted messengers. Same for healthcare. And it's about meeting people where they are and really engaging in almost a popular education way of like, these are your stories. These are your lived experiences. I believe everyone is an organizer and understands how to organize their community. Within our immigrant community, it was every grandmother that had all the details, and those were the organizers. Those were the trusted messengers on how to get benefits and work with the church and get food on your table. And when we invest in those structures and invest in those leaderships and really creating wide community table conversations about these issues and uplifting those voices is the need.
Yeah, and
Great,
this is Natalie. Oh, Natalie, I just wanted to add, I think too, like part of what we see in the HCBS space is that the system, it's so complicated to get into it and navigate it. And that's a direct result of the underfunding and undervaluing of it. If the system was properly funded and valued, we wouldn't have to make it so complicated, because it's designed to keep people out. And I think we don't know, to Nicole's point too, like we need to be asking people and older adults and people with disabilities themselves what they need.
Thank you. Yeah, designed to keep people out. I think that's a really important point. Let me turn to Stephanie now for what will probably be our last question. Stephanie, can you come off mute and introduce yourself, and then you can ask your question.
Sure. Stephanie Monroe with Us Against Alzheimer's. And when we were talking about challenges, I wanted to pose a question to the group about one of these challenges. And I just want to say on the outset, I'm a strong proponent of incremental gain and positive steps forward. And I do agree with people who've said there have been some positive steps forward. Unfortunately, they've left the adult caregiving community behind. So I guess my question is, is it a problem that we may be creating and not yet being willing to draw a bright line to say, if it's not going to be care for all, if it's not going to be care for parental care as well as adult care and people who are disabled, we're not going to take that package. If you continue to move forward with just a parental package, it's not good enough and we're done. Are we willing to do that? Because I think that will send a very strong signal. As long as we I think continue to, and we should be excited for what we've done, but as long as we continue to be excited for what we've done, we're not going to be able to achieve the kind of care for all that we really are looking for. So it's a question for reaction.
I think one of the reasons why we started Care Can't Wait was to actually have a vehicle to build collective power that drives that message. That there isn't, we're not building a care infrastructure without all three pillars of the care agenda. And so, I think we're in the process of starting conversations about bright lines and red lines for at what point we say no, we're not going to support this. At the same time, really driving a narrative collectively that these are not interchangeable policies. We need all of them. And so, I think where we are is staying clear and strong about the need for all three. And I think the different scenarios of how things could unfold could create a lot of different challenges to that. So I think what we're starting to do right now, just to be totally honest, is preparing ourselves for that.
Yeah,
that's what I would say. And I would love for any of my colleagues to chime in here, including those who weren't on the panel.
Yeah, I think that that's absolutely true. I think we're starting to have those conversations. And I just have to say, as one of the only, I think we're the only disability group that's part of the Care Can't Wait principal table. It can't be understated how important it is that that table exists, because Stephanie, that's a really important question. But frankly, we wouldn't have even been at the table as disability and aging organizations with groups that are working on childcare and paid leave to have these kind of red line conversations that we are starting to have. Because again, we all kind of were fighting for scraps at the bottom. So I think we're not there yet, but the nice thing is that there's a table where those conversations are happening, where we're changing language and changing. Because I think I hear you. I'm worried about that too. But I think no one was mad. For example, I think I can give an actual point, which is when the American Jobs Plan came out, HCBS was there. Everybody knew that the family plan was coming out, and there was some dynamics there, right? But everyone just supported it all. No one said, "Oh, I wish ours was in there," or "I wish." And that's just a huge sea change and representative of why I think we don't have to worry about it being one thing and not the other, but the rising tides lifting everything up because we're all at the table.
Thanks.
All right, well, we have come to the end of our time for this discussion, but we will all have much more time during the rest of the meeting to dig deep on a lot of these questions. So please join me in thanking our incredible panelists this morning, or this afternoon, not only for their wise insights in this discussion, but also for the incredible work that they have been doing and that they will be doing moving forward. So with that, I would like to pass it back to Erin. Thank you.
Thank you so much, Anna, and thanks to that amazing panel. I needed to jump back into our agenda quickly because in my introductory remarks a moment ago, I made a mistake. I was listing all of the wonderful fund partners of the Care Fund, and I omitted one, which is Open Society Foundation. So I didn't want to let the meeting pass without recognizing them as an incredibly important member of that group, and that we appreciate their partnership. So apologies for that oversight, and I'll now pass it over to Pooja.
Great, thank you, Erin. For those who I have not met yet, I'm Pooja Devan. I'm a consultant to the Care Fund, and I'm just going to guide you to your next part of the call, which is 4 breakout sessions that will run concurrently, and they each cover 4 of the different strategies to achieve change to our care infrastructure. So they're federal policy advocacy, state to national organizing, communications and narrative work, and state and local implementation. And so you'll each be zoomed into a pre-assigned group where you will see both donor and grantee colleagues, as well as a facilitator. And the facilitator has a few questions that will help kind of guide the discussion, but we really actually just want the breakout to be generative, open discussions that involve everyone, and either dig deeper into the preceding panel that you just heard or get into some of the specifics of those strategies. So hopefully it will be very generative space. Each breakout will be about 40 minutes long, and then we'll bring you back to the big group for a closing. So we'll see you then. And Matt, you can go ahead and just Zoom everyone over.
I know most of you. And I am here in my capacity as a consultant with the CARE Fund, but I also am the Director of Women's Economic Justice at the Century Foundation, and I do some consulting work with National Domestic Workers Alliance and Family Values at Work, so I get to wear many hats. We're going to start just by doing a quick introduction, take advantage of the fact that we're in a smaller group and can get to know each other a little bit. Just name, pronoun, organization, and where you are right now. And then we will dig in. I will ask the first question. I'm in Brooklyn, New York right now, and I'm going to pass it over to Dawn. Hey, Dawn.
Good afternoon, everybody. Dawn Hucklebridge, she, her, hers. I'm the director of Paid Leave for All, and I am here at home on Capitol Hill in DC. Wait, and do I pass it to someone else, Julie?
Yes, please.
All right, I'm just going to see the first person I see, which is Race.
Hi, everyone. My name is Race Alkwili, he, him pronouns. I'm the summer intern with the Future of Workers team at the Ford Foundation, and I'm currently in New York City, and I will pass it to Lauren.
Hi, I'm Lauren with the Perigee Fund, she, her pronouns, and I am in Seattle, and I will pass it to Katie.
Hi, I'm Katie Beckman with the David and Lucille Packard Foundation, and I use she, her, hers pronouns. And I will pass it to Stephanie.
Hi, Stephanie Monroe, she, her, hers. I'm with Us Against Alzheimer's in Washington, D.C. I live in Leesburg, Virginia.
Sasha.
Hi, Sasha Bruce, she, her, hers. I'm sitting in DC, thankfully in an office all by myself with no children in it. And I work for Care Can't Wait. Nice to see you all.
Whitney.
Thanks, Julie. Whitney Pesick, she, her pronouns, National Women's Law Center, and I am in Northern Virginia, and I will pass it to Maddie.
Thanks, Whitney. Hi, everyone. My name is Maddie Taylor. I'm with the Community Health Acceleration Partnership, and I'm located in Baltimore, Maryland. Anybody else still need to go? Arissa, have you gone?
I have not. Hi, Arissa Scalera, she, her. I'm with the Robert Wood Johnson Foundation, and I am normally based out of Brooklyn, but currently just outside of Pittsburgh, Pennsylvania.
Natalie.
Hey, everyone. Natalie Keene, Justice and Aging, she, her. I am in Alexandria, Virginia.
Albert. Oh, you got it. Okay.
Hi, can I assist in any way?
Oh no, just wanted to see if you wanted to introduce yourself.
Oh, yes, I'm Albert from the AV team at Ford, and happy to just listen in the conversation. You know, always grateful to hear the good things that you guys are doing.
Thank you so much. Okay, so my first question is directed toward funders. Just after hearing that great conversation from our panel, what follow-up questions do you have about the national opportunities and challenges that were discussed? And if you're not a funder, you can answer that question as well, but would love to hear from Lauren and Katie and Arissa and folks who come from that perspective.
Something we're talking a lot about at CHAP is a lot of the movement and excitement and funding for community health workers and community-based workforces, and CHWs or promotoras weren't mentioned explicitly in the plenary, but I'm wondering for those of you who work in this space, where is the overlap between community-based workforces and aging and labor and paid leave and all the wonderful things we're talking about, and sort of how can those two fights and forces for which there's a lot of infrastructure and investment going on now, how can we kind of marry those and what's the overlap there?
Thanks, Maddie. And I see Natalie shaking her head. I wonder if you want to start off by answering.
Yeah, I can chime in. I mean, I don't have haven't haven't thought this all out, but it's something I've thought about too. And we know that like community-based organizations are so important to both this kind of question of figuring out the need and getting the messaging out there to people about the services that are available, but then also providing the services. And the Aging Network, many groups are funded by funding authorized through the Older Americans Act and the HHS Administration on Community Living. And, you know, we'd like to see more around that, like, and marrying the Older Americans Act programs, because there is a good network there with the Medicaid funding. I mean, sometimes their groups are providing services under Medicaid as well, but not always. And I think it's just another layer of complexity and another opportunity to really you know, lift up all these programs and unite them better under robust and sustainable funding sources.
I thought that was a great I thought that was a great question, because actually I have to admit, in the space where I live, which we use community health workers and promotoras as sort of healthcare navigators, hadn't really thought about them in terms of this, but I think in the perspective of, you know, especially in the light of COVID, right? They were treated as essential healthcare workers and they would not have been given leave. And probably now I'm quite sure that, as we've seen, many of the millions of women who have left the workforce have left because they were in those health fields, frankly, where they were essential workers, but they weren't receiving the testing and the other protocols needed to protect them, PPE or otherwise. So I think that warrants a really unique conversation in this space. We do think of, you know, the care workers, domestic workers, you know, professional paid care workers, but I hadn't really thought about the promotors and the community health workers in that same light. So I think that's really interesting that you raised that.
Thanks. Other questions? Katie?
Thanks, Julie. I thought the discussion around trade-offs versus staying together was incredibly compelling. And I'd love to hear the thoughts of those on this call. And I think the other piece that goes along with that is, what is the plan after reconciliation? How do you leverage either what has taken place or I guess I'm trying to think of the best word, do cleanup on what has taken place. Anyway, I'd be grateful for your perspectives.
Dawn, you want to kick us off? One thing just to note, you know, with the American Rescue Plan, childcare and paid leave were and home and community-based services were part of it, and paid leave was not. And so that was a moment that was kind of particularly challenging, you know, and I think people have really rallied to make sure that that is not the case as we move forward. So yeah, Dawn, I'd love to have you start us off.
Yeah. So yeah, I mean, there were a lot of sort of questions about procedurally what could happen with the rescue plan and you know, what had been framed as a mandate versus a spending program and all of this. But I think that there was a lot of thinking a long time ago, you know, even before the pandemic hit, about how these issues that predominantly impact, I will say, caregivers, but women of color, how they have always been sidelined and always been sort of not seen as urgent or economic or imperatives. And I think this has brought more power, you know, by kind of banding together and not, you know, having this sort of scarcity mindset. And, you know, even while I will say my job is to service paid leave as an issue, I know how much power we have by banding together and showing that these issues are interconnected, in many ways inseparable, and that, we're not starting from a place of negotiating against ourselves or being pitted against each other, and that you can't just check one box and say that we've done care, particularly after what we've survived over the last year. So I'm grateful that this table was in place, that we've sort of supported each other while we have not always kind of made progress in the same times, the same sequence, that we do see sort of like the long game, and that a win is a win for all of us, that we all need to have serious and robust investment. But I do think that is our hope. We're going to shoot high. We are not going to, start off with any sort of negotiation, but I think it is unlikely that all of us are going to end up with the level of investment and all of the components of the policies that we want. I think so that connects to your question about what happens after. If we are, work our butts off and get this reconciliation, package through, there's going to be more work to do. And there's going to be probably, more improvements to the policy. There's a chance it's we're going to have to fight for it all to become truly permanent, most likely. We're going to have to do the work of both awareness and implementation and enforcement, and also probably continued advocacy. So I think of this as we will be lucky. Unfortunately, we'll be lucky if we get a serious investment, just because the chips have been stacked against us for so long. But I think that we have this once in a generation moment. We are better positioned than ever. And I think as long as we kind of stay together and keep demanding that there is no real long-term economic growth that leaves out care, that is not a recovery or a growth package. 90% of infrastructure, physical infrastructure jobs, we know go to men. And I think it's really important to say you cannot address the crisis and the long-term needs going forward and something that simply does roads and bridges, that's not recovery. So I think we're going to be in a good spot, but I think there'll be a lot more to do. And I think from Paid Leave for All's perspective, we are so just focused on all of the dozens of steps that need to happen over the next few months to get what we hope will be a big win, but knowing that there's probably going to be more to do.
And I could just follow up if that's okay with John's questions. I agree with everything that you said. Absolutely. I think there's going to be a lot of follow up, unfortunately, because reconciliation, remember, it's a budget reconciliation bill. So it's spending authority. It's going to be virtually impossible, especially with budget rules of order, that if it goes down that route, you can expect Republicans to be taking full advantage of every budget rule that they have, so that we're not legislating on one of those bills. So that basically means if you're looking at something like the Neal bill, to the extent that he's spending money, to the extent that he's doing tax bills, issues and things like that, those things will likely be able to go through. If you wanted to change definitions, like for example, expanding covered employees, expanding the definition of family and others who would be able to take advantage of the leave, that likely will not be able to take place on a budget reconciliation bill. There's some nuance sort of deeming as, we're going to pretend as if it had, but we're not going to actually change the language. That could happen, but those are going to be really nuanced. And with the 50-50 and without knowing how the senator from West Virginia goes, I mean, I don't know if I were in the seat, if I would even want to go through the reconciliation process, or if I'd want to try to find something freestanding later. I think that's going to be an important call to make.
Could I ask one follow-up on reconciliation? Stephanie, I feel like you would know better than most the answer to this. I mean, as you're going forward in your asks, are you also promoting revenue raisers
No.
to account? No.
I'll be honest, at this point, we want them to get the policy right first. And because we don't feel like we have an agreement on what are the policies that we all agree on that need to happen. And then we can figure out the pay for later. So getting people to that table, especially since, I'm doing a lot of work with, trying to massage Republicans on this. I want to create some champions. I want to get some positive voices out there. And if we let them jump right to the funding mechanism, we won't go anywhere. So I'm basically telling them, we're not going to talk about money today. Today, we want to talk about, if pretend you had a blank check, but what would that policy look like? And let's get that right first.
Thanks. Do others want to weigh in on either of those questions?
Yeah, I'll weigh in on the first one, Sasha from Care Can't Wait. To those of you that I don't know, I will say this is a quick one, but the necessary component in us in these three pillars, right? Home and community-based services, childcare, and paid leave hanging together in the Care Can't Wait Coalition is all the more important just because there are very big progressive forces that are beyond these three pillars that are also factoring into reconciliation. And the chum that is going to happen by no fault of anybody aside from the legislative process is actually with allies beyond care, right? We are in a environment where we do want there to be physical infrastructure. That's not our job to advocate for, but it's not a zero-sum game, right? We understand the narrative of jobs and all of that. So like, it is important that we can hang and hold down this like corner of what is like the progressive asks right now, because there are other people to negotiate with that we're friends with. And like, I just want to mostly recognize that because that gives even more power to this like corner of care really being in lockstep together. And to the division of what is often, I think, perceived, some of that has been because we have a White House that has campaigned on, won on, and is talking about a legislative package called Build Back Better. The things that they rolled out were two different things with two different names on it. So I think it is particularly acute to care that isn't for labor, for the environmental piece, for any of the other pieces of reconciliation, that we have been split in these two packages, which is fine because we're in there. And like, that's the first foothold that we have. But some of that is not of our own making, and we don't have a legislative vehicle yet. Like, once we get to that place, I think we're in a different kind of narrative space, but it is endlessly frustrating for me, if you can't tell, to have allies on the Hill or the White House be like, so what's happening on like advocacy for the American Families Plan this week? I'm like, actually, it's on both because care is in both, or vice versa. What's happening on advocacy for the American Jobs Plan this week? And so I feel like I'm constantly in like a reframing conversation with the very people who pitched Build Back Better. So just wanted to put that out there too.
Thanks. That's a really good point. The American Jobs and Families Plan, all one thing. Anyone else want to weigh in there?
I just just really quickly, just wanted to re-up something Sade said earlier, which is that, you know, Black women, you know, have, you know, intersectional, you know, policy needs. And it's when legislators try to pick, you know, one group off, like this will make the kids groups happy, or this will make, you know, the labor movement happy. People live intersectional lives, and it does such a disservice to the voter to assume that they're like only voting on one issue, that it's climate versus care or anything of the sort. It's all of these are worth the investment. And when groups, you know, peddle like their one issue and don't take into account everything else, you know, we're stronger when we're together and when we don't allow, you know, just specific policies to be siloed. But thank you very much, Julie. I'll let you move on to the next one.
Yeah, no, it's a really important point. It's, you know, it's not one or the other. Everything is interconnected. I'll just note one more thing about the revenue side of things. I think Stephanie's right that people are leading with it's the policy. But there is some work being done on the revenue side. And for example, there's a women's community group that meets weekly, and so Amy Matsui from the National Women's Law Center is going to be giving a presentation about where you could raise revenues and how to talk about the tax side and what the polling says about that it's okay to talk about some of the corporate taxes, depending on your audience. And so I think there is some work being done on that side as well. And I agree with Stephanie that especially with certain audiences, you want to lead with these policies.
Yeah, it feels like, I think part of the challenge as I've been having conversations with, we just did a big fly-in last week on Alzheimer's. And so we spent time with a lot of members of Congress. I think we hit 75 offices, pretty good amount, including Republicans, and feeling disingenuous when you're having to change your messaging depending on who's in front of you. It just feels creepy, but you sort of have to do that. When I'm talking to Republicans, for example, I make sure that they understand this is partial wage replacement. We'd like more, but this is partial. And somehow that's great. But it's a challenging thing to do that, to put yourself in that position of unveiling the fact that, we didn't get what we wanted. We're negotiating sort of from the middle on this already, to get people to see that we're not being greedy. We could have asked for much more, but we're only asking for this thing. So. But the response has been very positive, certainly at a staff level. People really had a good understanding of what was needed. People had experienced these issues in their own families. Their members had experienced these issues. It was sort of had, this bobblehead response of, yes, of course we support this. And so I think, my job is to try to make it easy for them to get to yes when the legislation actually presents itself, because I feel like the heart, unlike 1993, really is there this time.
Thank you. I wanted to ask the next question, which you've all alluded to in some way, but how are folks working together? What are some of the examples? Sasha, maybe you could talk a little bit about the amazing event that brought the vice president to the table on this, and then a little bit more about what else is happening across these issues, and what kind of an impact is it having that's different?
Yeah, thanks for that. I'm actually going to talk about the family meeting series as the example of that. So Care Can't Wait is doing a series of conversations with electeds and a family. It might be the head of a family, might be the kids, it's going to change each time. And it really is a one-on-one conversation. And what's really interesting about both in the curation of who the family is and the storyteller is, and also the conversations with the electeds, they're like, okay, so what is the issue that this is about? And I was like, this isn't actually about one issue. This is about their whole lives. And they're like, well, what do you mean? I was like, so last week we had Representative Jeffrey sit down with a woman who's an independent childcare provider, who is also a family caregiver full-time for her mother that was unexpected. And I'm like, this is going to be about all of those things. There was another related project with the Jobs Cabinet, and I had a similarly interesting conversation with Secretary Buttigieg's team, where they were like, I don't understand. This woman's a family caregiver, and she volunteers in a school. Why exactly is this the person we should sit down with? I was like, because you care about transportation, and she uses a bus to get everywhere, to get to her mother, to care for her mother, to get to the school where she volunteers, because they can't afford for teachers' assistants. Like, this is your everything. And this is what physical infrastructure funds and connects to. So it's been a really tangible example of forcing the interconnectivity, which has been really beautiful and fruitful. And the series will go through the end of August. We'll mostly be focused on the Senate. Knock on wood, I don't have all the people I want locked, but we'll also focus on some leadership voices from the House as well. In so many of these moments, we're often telling of the interconnectivity. And I just think it's such a beautiful example of the showing of the interconnectivity. So.
Great, thanks. Others want to share about the joint work?
Well, we are working at Us Against Alzheimer's. We have a paid leave alliance for dementia caregivers. We're working with national organizations as well as state organizations that are involved in this disease. Just by way of background, Alzheimer's is the 5th leading cause of death for older Americans in the United States. And so 6.2 million people have this, and about 13 million unpaid caregivers that we know of. Because a lot of people we find, they don't even characterize themselves as caregivers if they're just a family member. They just think, if I'm a parent, I'm not a childcare provider, I'm a parent. If I'm a sister or brother, I don't characterize myself as a caregiver, even though I might have to take time off for work to be with my loved one. So getting the definition so that people understand so that they would take advantage of even what's out there is a challenge. But we have formed a coalition with groups, like I said, across the country, National Alliance on Caregiving, Hilarity for Charity, which is Seth Rogen's group, and others, about 14 of us as patient advocates specifically for Alzheimer's. We know that there's a larger coalition that will be forming around cancer and other patient advocacy voices. The last time we did paid leave, it was so much easier. The conversation was so much easier when we were talking about parental leave because it's predictable. You know what's going to happen, pretty much. You know how long the person's going to take off, pretty much. With incremental leave that people who have serious medical conditions will be taking, it's much more challenging for businesses. And so being able to put that face and align our conversations as a larger patient advocacy community is something that we're actively involved with and participating in.
Thanks, Stephanie. That's great. All right, I'm gonna move to our next question, which is, we know we have this great opportunity. We know we have some resources that we need. What additional resources are needed? What are the remaining gaps? And as we think about what the biggest obstacles are going to be, what do we need to fill those gaps? What's going to be most important?
I don't want to hog the conversation, but one thing I wish we had was an economic policy brief on what happens if we don't do this now. What happens to the workforce? What happens to our patients? What happens to Social Security, right? If people aren't working and able to pay in, and we're already talking about Social Security going belly up, what does not investing in its infrastructure mean for our future? And I haven't seen that yet, and I'd love to have that.
Yeah, that's a great one. I know the Department of Labor in what the Obama years did the cost of inaction specifically around paid leave, and I feel like we could build on that for our larger.
Okay. Wasn't aware.
Yeah, they did a really good.
$2.5 billion a year. Yeah.
Yeah, we can share that too. Others, Dawn?
One thing I will say is that we have amazing champions, and this fund is filling a gap that I think has been there for a while in terms of what's needed. Honestly, it's just scale. I mean, I think we've been tremendously scrappy as sort of a larger movement at what we've accomplished with the resources we've historically had. And I think, to think about kind of other issues that sometimes, we've been compared with in the past, there's all kinds of things at play, historical sexism and racism, but also it just comes down to dollars too. And I think that this was needed. And I kind of wish, we'd had it, but we had sort of the foresight to know about what was coming down the road in the pandemic. And, I just wish we'd had it even sooner. But this will make a world of difference, because I think it does come down to scale and to flexibility of funding and to political dollars and all these other things too.
Whitney, I saw you come up mute.
I was just going to highlight again something Sade said, which is, money to the field, to actual organizers on the ground. I think, when you're able to provide a meal and childcare to communities so that they can organize and can meet and can strategize together, it is just the little burdens like that, like transportation, to those of us that have the accessibility to those kinds of things, but it could be the difference between, having a robust community meeting and being able to really get at the grassroots level is really just funding those people that are on the ground is also critical.
Thanks, Whitney. I think another thing that we're seeing on that front is, a lot of groups that are based in states have to do a lot of state work right now, and legislative sessions are wrapping up. And we're also asking them to do this national work and talk to, and so making sure that they are resourced to do both of those things and not having to stretch even thinner after a really challenging 16 months of, COVID on top of all of that work. So I think that's another important piece. Others?
This is Natalie. I'll just add in, I think, as others have mentioned, like, this isn't going to be the end of the fight. So I think we need more champions on the Hill of these issues, and I think we're laying the groundwork for it. But especially on Medicaid, home and community-based services, it's always the same people who are introducing the bills and really pushing them through. That I think we need to broaden that base of support.
I'll jump in and add, sorry, was there somebody else ahead? I wasn't tracking the chat.
Go ahead.
The champions on the Hill are plentiful in the silos of these issues. But as great a work as we're doing in allyship on the advocacy side, it would be great to have more members carrying water on the whole. I mean, an example, I know that HCBS has gotten a lot of attention given the pandemic and like coming out of the American Jobs Plan, but it hasn't been around for very long. So they don't have really champions the same way. And then there's like a weird silo that still happens because it's, the way business has been done on the Hill. And we haven't translated our connective tissue to those folks. So there's still work to happen there.
Thanks. Yeah, that's a really good point, that more champions, but also more champions who don't feel like they need to silo. And, you're right, the way that it often works is somebody wants to have their area of expertise, their area that they're the leader on, and it's hard to share sometimes when you're a member of Congress. But I think we're seeing more and more of that now, right? Where we have, for example, on, the Jamal Bowman's bill, which is the Care for All bill, which kind of does cut across everything and makes the point across issues. And, on paid leave, where we have, Neil introducing Deloro's bill, right? So there's like pieces of this that are cutting across, on childcare, we have lots of different champions, but yeah, how do they think about how paid leave fits into childcare and then fits into HCBS?
And not to veer close to the legal line here, but there's like a really, there's the political narrative of like how advantageous these issues are to members, right? Like we all know that people start giving more disposable income when they're in their 40s, but those people are also the folks that are the sandwich generation. Like there's just like everything going for them to tie this together. We just need to help them see the advantages on all fronts.
Do folks have other pieces they want to highlight or other questions they want to ask each other? That would be helpful. And one thing I will just flag is, I know in conversations where we'll talk about childcare and how we don't have any advocates in this particular state, or we don't have robust advocacy in this particular state. And I know I've not been able to go to all the Care Can't Wait meetings. Are there thoughts on how we can better say, okay, let's make sure every key target state is covered across these issues? Is that work happening, or is that work we can be doing?
Dawn, you look like you want to go.
I was just nodding, thinking about it. That's a good question, Julie, and I'm sure others will have thoughts, but something we've always talked about at Paid Leave for All is the need to do really careful mapping of the field and to make sure that we're not, that we're aware of all the groups organizing by state, that we're not duplicating. And I'm sure that that's been done kind of across issue areas, but I imagine there could be more coordination in terms of the actual field and organizing. But but I don't want to speak to what as I said, I'm sure there has been a lot of that done already.
I agree with that. I'll also add that some of these places where there isn't a member organization that does like legislative advocacy in some of these places, because that's really what we are talking about in moments like right now, even though we need all of the other types of advocacy too. The solution isn't to stand something up. It is to look at who's there. And it's a mixed bag, right? West Virginia isn't the perfect example because like Dawn's network has done great work in West Virginia as part of the coalition. But if you look at the like major state players there's like 2 or 3 that have a continuous like respected presence, like really 2 or 3. If you look to Arizona, there's a bunch more, but the Republican state legislature has continued session 3 more months just to mess with them, and it's worked. So they haven't been able to do anything else. So I don't have a perfect answer to it, aside from like each state is different, which I've never really said, and with a straight face when it comes to capacity.
Yeah, that makes a lot of sense. All right, it looks like we are wrapping up. Well, thank you, everyone. Really appreciated the conversation and everyone's participation. And I feel like we are in a very exciting moment, and I'm happy to be in it with all of you.
Thank you for leading us.
Yeah.
Thanks, Julie.
See you soon.
Thank you.
Oh, I see.
Oh, sure.
Sorry.
I will pass it to Denise.
Hi, everyone. Thank you, Lindsay. Denise Castillo de la Sola, pronouns she, her, and hers. I'm the program director for early childhood at the Irving Harris Foundation. I am in Chicago, so we're in Chicago, but we fund at the state, multi-state, and federal level. And I will pass it over to, let's see, Laura.
Hi, everyone. I'm Laura Parsons. I am with the Kellogg Foundation. I support our national team and work in both the care infrastructure and also early childhood education. So it's nice to meet all of you. Oh, I'm in Portage, Michigan, and it's just super humid and gross. So. My 6-year-old just reminded me to pass it. So sorry about that. Pooja,
kids.
I also apologize. I am distracted. I'm dealing with some breakout group technical problems, but nice to see everyone. My name is Pooja Dhawan. I'm a consultant to the Care Fund. I'm joining Kristen in very sweltering Pacific Northwest, where we're all freaking out by like the temperatures that are unprecedented. I use she, her pronouns, and I think that was all I was supposed to do. I will be a bit distracted, so apologies if you catch me.
I'll pass it for you, Pooja. Let's pass it to Lainey.
Hi, everybody. I'm Lainey Romero-Alston with the Open Society Foundations, also use she, her, and hers. Lindsay, I'm also in Westchester and New Rochelle, New York. And it's warm here too. Lovely to be with you all. Jen.
Thanks, Lainey. I'm Ijen, based in Chicago, use she, her pronouns. Really excited to have more time in conversation, and I'll pass it to Erin.
Hi, everyone. Erin Moore with the United Parent Leaders Action Network, or UPLAN, she, her, hers pronouns. And I am based in Chicago. So along with Denise and Laura and maybe others in the Midwest, it's humid.
I think we got everybody, Erin. Am I missing anybody?
Brooke, we might get Sade back with us.
Hey.
She's supposed to be with us.
Okay, there she is.
Okay, great.
Hey, everyone. I was just in another room. Hey, are we doing intros?
Yeah, Sade, we're doing intros. I'm Brooke. I'm facilitating. We have a great crew here of people, a mix of funders and folks doing the work in the field, and we're just doing name, pronouns, organization, and where you are.
Awesome. Sade Moonsamy, she, her pronouns, currently is the interim ED for Family Values at Work, and I'm based in Silver Spring, Maryland.
Thank you. Thanks. And we were just commenting on how wonderful the last panel was, and we're really excited to go deeper. This is a chance for funders who have a specific interest in kind of translating the state and federal work to go a little deeper with you all and understand what you all need to reflect on any of our experiences as funders. I know a lot of folks on this call have been doing this work, both from the funding side and the grassroots and advocacy side for a number of years. So there's a lot of experience just amongst us here. I guess I'd like to start us out with just, prompting kind of question. I think there's often an underestimation of how complex it is to translate state organizing work and the experience of that to a federal policy level, or how one actually translates that to push federal policy forward. For the funders in this breakout, I'd love to hear from you if you have any questions based on your experiences of supporting ecosystems at the state and national level. What questions do you have for the folks here who are doing this work currently and have been doing this for a while? Denise, I see you're unmuted. I hope I'm not calling you out unduly, but I know you also have experience here.
No, I'll go ahead. I was thinking about it too. I think it was, Lauren, a comment that Chada, your discussion of what does that mean, like what's needed around whether it's language translation or messaging or political consultants or what have you. I also find it challenging when I'm trying to talk with some of my colleague funders about like, what does that actually mean about like taking grassroots organizing? And sometimes we get the comment of, well, why can't they just work with the federal advocates to do it and they do their part and you do your part, and what's really needed. And so I think that would be really helpful, is to try to help us understand, particularly in this moment with ARPA, right, American Families Plan and American Jobs Plan, of what are some of the things on the ground. So I know you spoke a little bit to it, Jade, but that needs support, and how does that translation really like happen? Because I think some might be getting like a little bit of money to like do some of the federal facing work, but it takes a lot more than that. And I also appreciate what you said earlier about many groups have like 1 or 2 or 3 if they're lucky, right, organized and doing this work, but then they're expected to do so much and produce, impact quickly. So I said a lot, but that's like what's running through my head.
I can kick it off, but I know Erin has lots of great on this, and Ijen as well. I think, especially like in the context where we're seeing an attack on our democracy, when we're seeing attack on how voters are being engaged, how our organizing bases are being engaged, and overall like movement to keep us out of this political sphere, like the time is now to like organize on the state level so hard. And within looking at the state fights and the capacity that it takes to organize, when we're meeting with Georgia and they're like, well, we can't even give out water to people waiting online anymore. We can't like provide any services, like the impact of the state organizing structure right now. And then to ask those same organizers to organize on a federal level when we as nationals are trying to digest all of the recommendations coming out and guidance from HHS and get it down to the field in a quick way and train up people on federal organizing whilst they're learning state organizing. Like we just need a bigger infrastructure to move this package. I will pause there and let my other colleagues weigh in.
Yeah. I think there's that like connective tissue between, there's work that happens at the state and local level, and there's work that happens at the national level. And I do think that you're right, that there is this assumption like, why can't they just team up? And the thing is they can. It just requires extra time, energy, capacity, strategy, and in order to do that effectively, you just need, you need to have a shared field of vision. And so
creating the ability to see the same field of vision is in and of itself a piece of work. And so, like, I guess how we make that visible is really important, I think, for this next phase. And even more important to think about everything that can and already has been won at the federal level. Sade mentioned this, but the implementation of the American Rescue Plan, for example, is so clutch in terms of the confidence that members of Congress will have in moving another big package through, in assurance that it will actually have the desired impact, right? And they'll be able to tell a good story to voters. Like, this is our proof of concept. What's already been done, the so-called bird in hand of the American Rescue Plan, is our proof of concept. And if groups don't have the capacity both to support effective implementation at the state level of what's been done and to translate some of those lessons and that perspective into what we're fighting for currently, huge missed opportunities and potential risks there. So just that connective tissue, I think, is not just like nice to have and important to recognize, but it's pretty essential to our success.
I would just plus one on what Ijen and Sade said about both the connective tissue and the multi-layered engagement focus with extra resources being needed. And the multi-layered engagement isn't just linear, it's almost circular, because we need multi-layered listening to what's happening at the state level of what are the priorities at the state level, because often the priorities of what can move, and importantly, the opportunities of what can move at the state level, are different than at the federal level. So we need to be moving policies at the state level and showing wins at the state level with deep listening. At the same time as we are looking at where can the state level help move forward the federal level. So what state organizing needs to happen to move those federal legislators to push us over a win on our multi levels of policy priorities. So we're looking at least 3 policy priorities, if not 4, in this agenda. Obviously, paid leave, childcare, home and community-based services, living wages for all care workers, and also a path to citizenship for workers as well. So when we're looking at those multi-layered policy priorities at the federal level, we need to look at also, I'm telling you, this is lots of multi-layers locked together, empowering our members, listening, and building the base. So we have to do all these things at the same time. And like what Ijen said, we have to take also our wins. So we just had a big win on the CTC. We can lift 50% of children out of poverty for 1 year only at this point, if we don't expand what's happening with the American Jobs and Families Plan to cover expanded expansion. So what we're doing at Moms Rising is we're sharing the win, using that as a slingshot in coalition and collaboration with all of the organizations on here to say, here's how you can get access to the CTC. Now let's get engaged in building a long-term care infrastructure that makes this CTC permanent and passes those other policy priorities, as we're reaching in not to only our state membership, but our national membership, which overlaps, and into the voter file. So that's the expanding the reach. How can we reach into the voter file and expand the movement as well? So thank you. I'm honored to be here and to be working with you, and I'll pass it to you, Erin.
Yeah, I echo a lot of what Ijen and Kristen and Sade said. I'll just, give some examples of what this has looked like as one of the people that sort of sits in the space between our state and local organizing groups and some of our federal advocacy partners and funders. I think what came up in the plenary about, to Krista Scott's question about why aren't we drilling deeper into the systemic and equity and racial equity issues around access? I think we need to be scrambling the tables more, scrambling who's at the table and who's listening to who. And so a lot of what UPlan tries to do is bring grassroots parent leaders, moms and grandmoms directly impacted by these issues into spaces where we're meeting with funders, with federal advocates, and do that in a way where the table is set equitably so that they're not tokenized, but like the wisdom that they have is really heard. And we're trying to do some work around this right now. A lot of the conversation in the American Families Plan about universal pre-K is sitting in tension with a lot of our conversation about the care agenda and really wanting, programs for 3 and 4-year-olds, which yes, are a priority to parents, to be complementary to the care infrastructure that we're building in early childhood. And the moms and the grandmoms have so much wisdom. We have a lot of members from states that have piloted universal pre-K programs and have lived the challenges that can pose to home-based settings on childcare. So we're trying to have parents who have real wisdom on those issues come into some federal and national spaces. And we need support to be able to do that. We need honoraria for those parents to be speaking. We need, organizer time to help prep them, and organizer time. It's like capacity building on both sides. Organizer time to build the advocates' capacity to really listen and create a space where parents can be heard. So, I really think we're often told when U-Plan is invited to convenings and conversations and think tanks, oh, we just want organizers, or pre-COVID, oh, there's only funding to bring one person and we want it to be a staff person. So really want to think about how can we, to Kristen and others' points, build the connective tissue, IJan's point about the connective tissue, how can we think about the spaces we're creating to bring folks more into conversation with each other?
Just to piggyback off that, when we're thinking about organizing and this piece around relationship building, we're asking organizers to organize in the field. Many of them organize from like a place of need. So holding mutual aid events and bringing parents and providers in. So you have one event and you bring in 100 parents and families. Now that organizer needs to figure out how much time is taken to do relationship building with all of those 100 people that just came, which takes time. And really, when we talk about long-term movement building, I started organizing when I was 15 and being able to get education and leadership development across the way now to 35, which has made me politically active. And so the investment and the time that we put into individuals and the relationship building when we're organizing single moms, when we're organizing people who this is the first time in this country, when we're organizing around language access, when we're organizing rural communities, when your neighbor is not right down the street, is an investment in time in relationship building for these organizers, and the capacity to have enough organizers to invest in relationship building with these trusted messengers.
I just want to 100% agree with what you just said. There's a pull to commodify stories, often from outside of the organizations, and it takes such an important focus and resource to actually maintain the organizing on empowering. So for example, at Moms Rising, we have over 11,000 people who have submitted their stories in the past several months out of our over 1 million membership. And it takes a lot of time and resources, and it needs to be intentionally done. Also looking at social emotional care along the way, because empowering isn't just being nice, it's also making sure that people are empowered, not just for this week, not just for next week, but into the future. And that does take time. So I just wanted to plus 1,000 what you just said, Shanae.
While other folks are thinking of how, what the questions they might have or contributions, experiences they want to contribute to the conversation. I think it's come up a couple times that there needs to be some type of shared vision or space for that between folks working at the state level and folks working federally, as well as like an understanding on the part of funders that this is a long-term prospect and it truly is about relationships and respect and dignity for people. It'd be helpful, as a funder, for us to hear what you feel like funders have done right to help engender space for that work, and where you feel like we could really do way better. I know general operating support, like we've all heard that one, you know, and I think a lot of us try to do that and have, you know, kind of stepped into that. And, you know, in some ways the Care Fund is another attempt to be more aligned and coordinated as funders on top of the funding that we normally do to many of these groups. But I'm just curious, you know, what has been helpful? Like, what is feedback that you have for the funding field?
I think that the way that this Care Fund has evolved has been actually a really great model, and I hope that we're documenting it and kind of summarizing, because some of the choices that you all are making with the Care Fund are choices that come from the wisdom of this very question that you just asked and posed. Like, Brooke, I think that the funders that came together around the Care Fund were listening to the field, we're seeing alignment in the field and the need to break down silos in the field, and then proactively thought about, do we need to mirror that in philanthropy, and what does that look like? And then we're in conversation with the field about what that looks like, and then like did the organizing in philanthropy to like organize the fund, and then launched the fund in conversation with the field so that it could be another bump in narrative and momentum in our campaign. Like, the momentum that came with the launch of the fund was like perfect in terms of just having this surround sound of care has momentum, care is essential, care has to be at the like, care is something that everyone's paying attention to, like just adding oxygen in this moment. And I know it was a hustle to move quickly to make all that happen, but I just feel like there's been like 1,000 choices specifically around the Care Fund, even down to the presentation of the grantees and the logic of that at the top of this call, that I think have been really, really important and a real model for how we want to think about this kind of thing going forward.
Can I just maybe add to the stack as others are responding? Some of my question, Jen, I think had to do with that when we think about the state to the federal work and just where this table can be helpful, particularly on strengthening the both. Sorry, my dog, Kristen, I heard your dog barking. My dog has been talking to your dog the entire time, by the way, of her. Yeah, just sort of where the other opportunities in addition to Brooke's question about sort of where things, you know, what's helpful and what's not helpful, but where we can be helpful. I know that one of the biggest challenges always in other efforts, you know, I'm thinking about other, you know, Caring Across Generations, Jen, when that was created, and creating the Care Fund there with that provided flexibility to really move resources to the campaigns and to the ground, but also knowing that there needs to be long-term sustainable resourcing of folks on the ground as well. And so just where there's opportunities that we can be thinking about in key places, engaging donors that are really local, who are not going to be connecting necessarily to the federal, you know, where there's other opportunities for us to be helpful with other donors, individuals, institutional, and public.
I did just think of something in terms of an area that we need help, which is that, you know, all the leaders in this space are women, and lots of women of color. And there is like this weird dynamic where there's like narratives that I hear about how organized the climate people are, and like weird comparisons being drawn around how organized and sophisticated climate is versus care. And so just like the same gendered, racialized stuff about our strategic acumen and sophistication and all of that, like, there may be a way in which this table of funders can help us kind of nip some of that in the bud. And I don't know, I don't have like a concrete idea for you yet, but I do want to just make it visible. Like, we're not doing that weird competition, annoying zero-sum thing. And I think it's really important that the leaders of the CARE movement are taken really seriously, along with every other set of leaders that Congress and the administration has to respond to. And so anytime we can, like, you guys can flank us a little bit on that, I think is helpful. Because as a movement of women, and it's the same reason why CARE has taken so long to be recognized, is also some of the underlying challenges we face as advocates in the broader space, especially when it comes to hard economics and economic data and analysis and all of that, right?
Thanks for that, Jen. I think the divide always pulls us apart, and there's no need for it. I think one of the things when I think about climate as well, especially to a mom to a preteen, like, they're all about climate, and are also should be all about paid leave and all around childcare and how these issues like connect. And as we often see this movement, it's like, how are we engaging youth in this movement and showing that there is like a shared issue across all of these issues when it's climate, paid leave, and childcare, because the hotter it gets and when schools close down, and because there is a big weather thing that happens. We just started giving weather days off at my job for like bad climate stuff. Like, how do we build on that trajectory and like close that silos? The other thing that was helpful from this fund was rapid response funding. So there's annual funding, that's always great. But as we're in states and as campaigns arrive, like the ability within COVID for funders to do rapid response funding, as we saw issues arise in the state, as we needed to really drum up either messaging or narrative or digital actions against opposition messaging in the moment, was so critical to so many of us to be able to get rapid response funding. Especially as things are down to the wire, you know, time is scarce, as Jen mentioned, like, and the rapid response Gen Op funding has been super helpful. Our model internally is that we do like 1 year annual funding, but then we have 3 opportunity rounds for when things pop up. I think the other thing, and thank you, Denise, was like language access funding, making sure that we're both thinking about languages, thinking about ADA compliance as we're rolling out all of these messaging. Like, it's great to have a lot of written word. What does that mean for someone who is blind? What does it mean when we're talking at people when they're deaf? Like, how are we thinking about the full spectrum of abilities and how we need to produce this and the funding that it takes for that? Which also requires for many of our state orgs investing in technology and infrastructure that they cannot access because of this, like having these extra add-ons to Zoom, having extra ability to go mobile and have hotspots when you're organizing in different areas, and be able to relay those messages. Like, funding technology infrastructure for state organizations are so critical right now.
100% to what's been said. The only things I would add, you know, I mentioned this earlier as sort of sitting in the space between a lot of federal/national tables and state and local and grassroots tables. To have funding partners acknowledge the trust and the deep responsibility that those of us sitting in that seat feel whenever we need to go to our state and local partners for an ask related to the funding, by giving more time for that ask to be able to be conveyed, you know, in alignment with everything else that's going on, or even just sometimes acknowledging, like, I know you're making this ask, you're only able to make this ask because of all of the listening and trust and showing up for folks that you've done. And so I want to do this in a way that, you know, whether it's, you know, we need X, Y, and Z for our comms, or we need, you know, speakers for an event or whatever it is, acknowledging that, just as the, you know, the state organizers are holding a lot of trust with their leaders as we in national roles ask them to engage leaders in federal stuff. I think re-granting to state and local folks as nationals is a lot of work, as you plan is learning. And I'm so grateful we're in a position to be able to do it in large part through the work of the Care Fund. But like, we're really trying to do it in equitable ways, in ways that honor the culture of the relationships we have with our partners. So like being patient with us as we figure that out, but also creating spaces like this where UPlan can learn from some of the other folks that are involved with the Care Fund on how to do that well, I think is useful. And finally, just funders who are transparent, program officers who are transparent about what your influence is and isn't, is really helpful, right? Because it's so much more helpful to me to get into a space where I can sort of empathize with the constraints that a program officer is operating within, and then we can kind of build together from that shared understanding versus me making all these asks that are sort of pushing on the wrong things that the program officer isn't really going to be able to strategically push on back at their foundation.
Cheryl, I saw you stacked a question. If you want to go ahead, we have about 4 minutes left.
Yeah, I mean, it just sounds like you all have to hold so much. How do you calibrate between like taking care of your organization, taking care of your people who you're doing your grassroots organizing with, taking care of yourself? Because I think that'll help us as funders just think about what you're holding.
This is
I'll start with this one.
Question. Go ahead.
Yeah. I was just going to say listening is so key. Listening to our teams. Moms Rising just recently did a week of wellness where we just closed the whole organization for a week of wellness. So listening to our own teams, listening to our members, listening to elected leaders, and listening to where change is possible and change is needed. I just wanted to share, just in response to the prior question, breaking down those barriers both vertically through city, county, state, and federal, and horizontally through issues can mean that sometimes in our listening, we need to expand our state level policy priorities. So listening means both reactive, which is where the rapid response funds come in, and proactive. And just really knowing that we are building huge change, but we might not build it all right now, this very minute. So I just want to thank you all for being with us right now and also into the future, because I expect we'll have big wins, but even bigger wins in the years to come as it all adds up. So I wanted to thank you. Go ahead, Ija.
I don't have a great answer to this question, but I did have one concrete thing in this moment for support, which is that for those of you who are connected to donors who can do direct advocacy as individuals, or families or within their networks, now is really the time. I would say like between now and really July 4th weekend is a critical time for securing pieces in the reconciliation plan. And then after that, 2-3 more weeks to really shape what's in it, and a call from a donor to a Leader Schumer or to, who met Mark Warner if they're from Virginia, or, whoever is actually really, really impactful. And it's, obviously going to be flanking of everything we're trying to do at the grassroots and constituent level. But to the extent that you are connected to donors who can do that direct advocacy, now is really essential for that. And also just thinking creatively about any other circles of influence. Like we're all just kind of going through our Rolodexes, like asking everybody to make calls, like this is the time.
I want to add that like it's not always as sexy for people to think about this, but actually funding HR departments for nonprofits and for smaller nonprofits is so critical, like a basic infrastructure, because funding comes down for organizing or comms, but never for actually like HR needs. Like, do our state organizations actually have the ability to do paid leave benefits for their own organizers? Like, let's start in-house of what our benefits and policies look like and fund those. So fund HR.
Great idea, Sade. I like that suggestion a lot.
Thank you. This has been really helpful. Thank you for so much concrete feedback and sharing kind of the realities of the work. One great thing about the Care Fund is it's a really diverse group of funders, many of which are family foundations that can work with their boards to do direct advocacy. So I think that that's really helpful to hear that feedback. And also to hear about how some of the work is being, or the people doing the work are being characterized because of who you are, as opposed to the absolutely incredible advocacy and collaboration and strategic genius that's actually happening. So just want to thank all of you for taking time out of your work to share with us. It'll make
Hello. Hello.
I'm super excited to be facilitating this conversation. You are in the Communications and Narrative Change breakout, which is one of the topics that I find the most exciting and interesting. So I was really happy to be given the opportunity to join you today and facilitate this conversation. We are recording still, just so that everyone is aware. And to start, we're just going to go through and introduce ourselves, since we didn't really have a chance to do that in the big group. Please give your name, your pronouns, your organization, and where you are located. Let's see, there's 11 of us, so maybe I'll just call on people. I think that might be, actually, I'll call on one person, you call on somebody else. We'll do it that way till we get through everybody. So I am Erin Courier, she, her, hers. I am with the W.K. Kellogg Foundation, and I am currently in the lower peninsula of northern Michigan, near Lake Michigan. And I will pass it to you, Jason.
Great. Hi, all. I'm Jason Resendez with Us Against Alzheimer's, pronouns he, him, his, and I co-direct our Paid Leave Alliance for Dementia Caregivers. And I'm in Washington, D.C. Oh, and I will pass it over to Marcus.
Thanks, Jason. Hi, everyone. I'm Marcus Escobedo, and I am Vice President of Communications and a Senior Program Officer at the John A. Hartford Foundation. He, him, his. Our organization is focused on improving care for older adults. We fund nationally, but I'm located in New York City with you all. And let me pass it to Diane. Who I see next to me?
Hi, I am Diane Russ-Tierney. I'm the new Senior Director of Advocacy at Caring Across Generations, and I use the pronouns she, her, and I am based in Washington, D.C. And I'm going to pass it to Krista.
Hi, everyone. Krista Scott, she, her pronouns. I work at the Robert Wood Johnson Foundation. I'm a program officer in the Healthy Children and Families theme. And I am located in Bucks County, Pennsylvania, just across the river from Trenton, New Jersey, on Lenape land. And did I get everything? Sorry, aside from picking someone else, there's so many things happening, and I'm sorry, I'm not feeling well, so it's all just sort of a blur.
You're doing great.
Okay,
yeah,
great.
You're doing great.
Love communications. And I will pass it to, so actually, can you say it for me? I don't think I heard them say it earlier. Is it Gwen?
Gwen?
Gwen? Okay, Gwen, thank you so much for the assist on getting your name right. And I'm going to pass it to you.
Awesome. Thanks, Krista. My name is Quinn Din. Pronouns are she and her. I'm the Executive Director of CRAC, the Southeast Asia Resource Action Center. We are one of the proud members of the Diverse Elders Coalition, which is a grantee of the Care Fund. And I'm calling in from Alexandria, Virginia. And I will pass it to Nicole.
Hi, everyone. Nicole Jorwick from the ARC of the United States, she, her pronouns. I am physically located in Chicago, but usually I'm in Washington, D.C. And I can pass it to Emily. Well, there's two, so Emily Mead.
Good morning. It's morning here in Arizona. My name is Emily Mead. I'm with the Virginia G. Piper Charitable Trust. I oversee our healthcare and older adult grant giving areas. And I'm actually homesick today. So thanks for letting me still join with my video off, but I was really eager to listen in and learn and think about how we can take what's happening at the Care Fund down to a local level here in Maricopa County, Arizona. And I think that was everything. So I will pass it to Tony.
Thanks, Emily. My name is Anthony Scarano. I'm program assistant for the Future of Workers team at Ford Foundation. So if you have at any point reached out to somebody on the team, I'm sure we've corresponded before, but it's always nice to put names to faces and of course meet people that I've never met before. Pronouns he, him, his. I've been with Ford since September of 2020 and I'm based in Brooklyn, New York. So not too far away from the office. I'll pass it to Robin. Pass it to Robin. There we go.
I'm Robin. I am Chief Communications Officer for Schuster and Family Philanthropies. And I'm based in Atlanta, which is one of our 6 offices. And forgive me, I know I'm supposed to say something else and I totally forgot.
Your preferred pronouns.
She, her, hers. And I will pass.
Oh, I think it's Emily. I was just going to do your job for you. Sorry, Robin.
Thank you, Erin.
Hi, everyone. I'm Emily Hinsey with Grantmakers in Aging, she, her pronouns, and we are national in our scope, but I am based here in Fort Wayne, Indiana. I think that's everyone, Erin?
I think that's everybody. Did we forget anyone?
No, got Nicole. Got her.
Yep. Okay. Well, fantastic. And thanks to Krista and Emily Mead for dialing in, even though you're sick. Do keep your cameras off and feel free to also jump off if you need to. The purpose of this breakout session is really for us to just have a casual conversation. So I'm going to start us off, but really welcome and encourage anyone to jump in with questions, thoughts, ideas that will facilitate your own learning, as well as just anything that you're grappling with in your role that you think this group could be supportive of. We have, as you saw from the introductions, an incredible set of people in our breakout who are advocates on the ground doing just a kick-ass job right now of keeping the care drumbeat alive. One little quick tidbit that I would share is that, as I think many of you know, the Care Fund has a strategic communications firm under contract, which is Spitfire Communications. And we asked them how they had seen a change in their media analysis, what had been the change and the uptick in stories about care over the last 6 to 9 months. And in the New York Times alone, there was an 80% increase in stories about care. Now, we obviously haven't gone the extra mile to see were those all with a lens that we would agree with. Were our grantees and partners quoted as experts in those stories, but just the sheer volume of attention being paid to this issue right now is a testament to the work of the people in this breakout. So I would really love to turn to our grantees first and ask you, at this point in the movement, in the moment, what is the story that you're collectively working to tell now? And how can funders continue to support you in getting that narrative out? And I'll open up to any of you, whoever wants to jump in.
I'm happy to jump in, but I figured folks might have. Oh, Diane, I saw you get off mute. You start.
No, I think you should start. You've been doing this longer than you have a minute.
Well, Diane and I are working together to share stories together. But I can start. I mean, from a disability perspective, and I will say that obviously my role professionally is with the ARC. I also co-chair the Disability and Aging Collaborative and a couple of other kind of committees in DC. And so we're all really working together because not everybody is as lucky as the ARC or Caring Across Generations to have comms and grassroots support. And so we're really trying to make sure that we're sharing a story of the real level of need, and also making it safe, frankly, for families who do have that need to share that story. We learned in 2017, when the big threats were out there, that a lot of the individuals who received services themselves didn't know how they were funded. So just being able to share the narrative of what these supports mean to family members, or most importantly to the beneficiaries themselves, individuals with a disability or aging adult, what they mean to the families, and also telling the story of the workers is something that we're really focused on as well. And unfortunately, I don't know if it's unfortunate or fortunate, the reality is that oftentimes what gets attention is the hard stuff. And we have a lot of hard stuff. We have the size of the waiting list. We have the historic low level of pay and the historic over-reliance on family caregivers, and then the tragedies that did flow out of the pandemic. So the story that we're focusing on is, here's all the holes, and here's why we need a big investment, and frankly, a bigger investment than even the $400 billion for each CBS is, in order for a system that serves everyone.
And I would say I am relatively new. I come from having worked on death penalty issues nationally. Before that, at the ACLU, working on sort of gay and lesbian rights issues, marriage equality. And so I have those lessons I'm kind of bringing to this work. And I've worked with a number of the folks that you've talked about. Spitfire Frameworks, I know, is somebody that you've worked with. So I'm sort of bringing that perspective. And to think about this work, I kind of went back and looked at some of that information. I think one of the things I would bring forward is that we're talking about advancing a narrative. We're not just talking about getting people to talk in a different way or think in a different way. We're also talking about disrupting a current narrative, which is a little bit even more difficult job. And so I think part of the stories that we've been trying to do are about disrupting the narrative that care is an individual. I think I can touch on this. It's an individual issue. Your success at that is, your individual problem. And so to begin to make this a collective of a way of thinking about this work. And the way we've been doing it is by showing people telling their stories. And what that does is it not only raises awareness, but when people hear other people tell stories, it begins to build this sort of across the board understanding that this is really happening to a lot of different people. So it's the beginning part of breaking us out of our individual silos. But then to go to the point that Nicole made, the other part of the work is not just raising awareness that this is a problem that's common, but then also helping people better understand the structures and the systems and the policies that are underneath that. And so that's the next part of the work. And I feel like that's one of the areas where, we're going to need to do more work, as she said, because that takes, perhaps a different kind of work. And a deeper kind of work and more engagement, perhaps with the advocates and the people who are actually providing the services to make that happen. So we're working at a number of different levels. First, just raising awareness, then increasing public understanding, and so that's where the resources are going to need to be devoted.
Yeah, I would agree. Oh, sorry. Go ahead, Quinn.
No, I heard your voice first, Jason. Go for it.
Oh, I was going to agree with everything that's been said. And I think for us, we're really thinking about this on two tracks. One, the story that we're telling externally to the larger ecosystem about the importance of paid family medical leave across the spectrum of care. How vital it is for individuals providing care across the lifespan, and how those things must go hand in hand by elevating the stories of sandwich caregivers, for example, of young people providing care. We've done some, I think, great research on the impact of dementia care on the millennial segment of the population, and that actually got us interested in paid leave, as seeing that kind of data on the impacts of workforce disruption, specifically on millennials, and also on economic analysis we've done on people of color. So really telling that story externally about the importance of care across the lifespan, but then also the story within our movement, within the sort of dementia care movement and dementia community, about the importance of paid family leave as a policy priority. and really leveraging our data to show that this cuts across so many different issues for the dementia care community, from an economic justice perspective, from a racial justice perspective, from a navigating complex care and treatment perspective. You know, this is an intersectional policy. And really riding the line between knowing who our audiences are externally and internally has been really important for us. And I think having funders understand that both those segments of work are important and are willing to fund and support those two tracks, I think is really helpful. And you know, what we need in order for a sustained movement, right? Sort of paid leave is the issue today, but this is an infrastructure that we're building for the long term that'll need tending to. And I think that dual track approach is going to be critical moving forward.
Thanks, Jason. Thanks, Diana. Thanks, Nicole. I think what I would add in terms of the story that we're sharing is one that I think the panelists spoke to, which is that impacted communities have to be the faces and voices leading the work. And for the Diverse Elders Coalition, I think that the storyline that we're trying to really emphasize is that our communities have been devastated by systemic failure that has only worsened during this pandemic, from poverty to racism, and the need for a responsible response is now through this care initiative. I think in terms of what funders should know about the work is that for our communities, telling stories is deeply personal, and it requires so much trust, so much safety, and that the work of telling our stories first breaks through cultural stigma and trauma, where silence has been so historically what has been used to oppress our communities, but also our coping mechanisms. And so being able to unearth these stories by itself is a healing process that does not happen overnight, and that organizational voices such as ours serve as an interim and kind of a parallel strategy to voice those narratives in lieu of our communities sometimes who don't have that capacity yet. And so I think practically from a funding perspective, I think there is, it'd be great to have an understanding that communications work is not just about communications work. And for this care infrastructure, for example, the Diverse Elders Coalition created a press strategy to place op-eds and try to get more coverage around a $450 million proposal that we're advocating to be included as part of the care infrastructure. And through that, we were able to work with Ditto, which is a PR firm used to release press and to pitch to media our stories. And so far we've gotten, got 45 media hits within the past month. And that impact is 27.7 million media impressions. And what was required for that impact was, one, our organizations had to be funded to work with our communities. Two, our organizations needed communication staff. And then the third was the final communications firm to do the heavy lifting. And it really takes those three types of resources to uplift our community stories long-term beyond this moment as well.
Well, I think that's a really, really good point. I just wanted to piggyback on that for a second to say that, because I think your point about that it's a lot of work to get that done is incredibly important. We have like 10% of this person from time and me and whatever, we do our best. But I also, just as a registered lobbyist, need to say that whether we're talking about at the federal level or at the state level or even local level, those stories also, that's what moves the needle when it comes to policy. So it obviously, we need to get into the media so that we can make that happen. But it's also important that all of us have a database. Diane and I are working on some state level roundtables. It'd be great if, instead of having to reach out to advocates in all these different states, that we just had that available. But that takes a lot of infrastructure, word of the year. But it's really true. And I think I frankly didn't even really understand all that it takes in order to get the stories, make sure that they're told in a respectful way, but also in a meaningful way. And yeah, I think that it fundamentally is about winning the hearts and minds of decision makers at every level.
I just want to underscore that as well. A couple of things that I think are important is that the cultural competency piece cannot be underscored. And when you talk about trying to have a strategy that centers on the affected communities, I come from a community as well where you don't talk about your business, and it is personal and it's protective. And so figuring out how we navigate this in that and how we support people in doing that. And that's something we've invested in also, is kind of making sure that we're providing supports to the caregivers and care consumers who are receiving this. So we talk about it not being transactional. So that it's holistic in terms of healing. I'm lifting, I'm sharing a burden, but there's work to overcome that. And then also the support that has to surround that, because it does cost every time you have to share something that's very personal, oftentimes very painful. So I think that can't be underscored. And I think this is the last enough. And then the last piece really is making sure that we're able to connect those stories so that, it just doesn't become a collection of individual concerns back to the systemic and programmatic change that we want to see.
Thank you all. That's really helpful. I want to open it up if anyone has another point they would like to make, or if any of the funders in particular on the call have a direct question that they would like to ask. No? Okay, then I'll jump in with another. I'm curious about whether there are specific audiences that you feel you haven't been able to reach yet that are really important. And I guess that aligns a little bit to also like really understanding all of the critical messengers, especially as you think about messengers, yes, and also like the people who need to receive those messages and who they trust, and how you sort of have a really broad approach to thinking about strategic communications, given the various power dynamics at the local level, state level, federal level. And have you encountered specific sort of barriers in the communications campaign where we just haven't, as a coalition, been able to break through some of the maybe misunderstandings or misnomers about care broadly? So I guess that's two questions. Are there audiences you haven't been able to reach, and are there still barriers to getting the key message out there? Are you hitting up against messages, false messages, fake news? Nicole, you look ready to start.
Yeah, I just don't always want to be the first one to
go
talk.
Go for it. Go for it.
That was my report card in kindergarten. So I try to. I've learned. But I mean, I sort of previewed this a little bit in what I said during the plenary. But I mean, I think that we definitely miss the messaging, at least in the disability space with younger families, and making sure that we're engaging with folks. Meeting people where they are also means meeting people where they might not know what they don't know they need. And I think the same is true when it comes to the general public, because obviously, hopefully everyone will age, or everyone will need these services at some point. So I think that we're running into that. And certainly I can speak for the ARCs. From the ARCs perspective, we're doing a lot more in terms of ensuring that we're getting into underserved communities, but we have a great deal of growth to go in when it comes to that. And I think broadly too, making sure that when we are putting communications out and information out, that it's in plain language, that it's understandable. We've been doing a lot of growing in that organizationally as a disability organization, but what we've learned, unsurprisingly, is that doing that has meant that our materials are more accessible for everyone. But that's something that also requires a lot of money in order to do well. A lot of folks say it's easy read or plain language, but then when you actually run it through the software, it isn't. And all of that means that more people will become informed and then also be able to become an advocate themselves.
I'm happy to go. We've been trying to do some work in that area, and we started working with some folks on doing that. And I think one of the areas that we've kind of looked at is making sure that when we talk about quote unquote people of color, we're not looking at it as a monolith. and we're looking at the full diversity of folks and making sure that when the channels that we're using line up with the channels that that the people are using. So it's we're looking to see who's getting their information from TV, who's getting their information from certain publications, who's getting so we're trying to do that. We're just at the very beginning stages of that. So I think that's a big step forward. The other thing I think we're starting to look at is like different populations, our base, who are the people kind of understand this issue already, and how do we talk to them? And then who are the, some of the people who might be affected, but who culturally and by age are not hostile to our idea, but totally buy into this idea that, if you work hard and follow the rules, you get what you deserve. And this is your personal responsibility. Those are people who should agree with us because what they have the needs that we're trying to support, but they also have bring a value set that doesn't make them question or seek to really change. So you're at the very beginning stage of looking at some of that. And I will also say that as we work together in coalition, we are we're learning from each other. If you're not in the disability space and you are well-meaning, you don't know when terms or images that we want to use might bring back memories of things or throwback to things that are harmful, hurtful, or reinforce negative stereotypes about people with disabilities. And I think it's also true as we work with more and more diverse communities. There are tropes that we may not know about. And so it's a learning, but it's part of, I think, what it means to be an expanding and more progressive population where we're trying to learn about one another. And then the last thing I'll say is, if we touch on from the other part of the conversation, is that we need to bring in bring values, because I think if we can identify a common set of values, that kind of helps to bridge these different gaps across the board. Do we have values that say there is some connection to another member of the community, and there is some common value that everybody deserves care, and we have to figure out how everybody should get that care. So those are the conversations that we are kind of trying to drill down on these new, not so much by demographics as much as understanding the difference among demographics, but also recognize there are different ways of thinking about this issue within the population that we have to reach.
Yeah, and I just build off of what Diane was talking about in terms of audiences. I know for us and our specific focus, a big part of that has been engaging Republicans. And so I know that, that's part of the movement and part of our strategy, because as an Alzheimer's organization and our specific organization, we've always had very strong bipartisan relationships, and have always positioned this as an issue that cuts across both parties, and have had a lot of success with that. But we've had to, because of that, we've, really thought about messaging broadly. But now we're having to think about it really specifically in terms of what I can say to one audience and I should not say it in that way to another, which we hadn't had to think about that as much before on our issues. And so that's been, for us, an audience that we're trying to get better about how to segment and engage. And thanks to our funders for supporting us doing that work of even just segmenting our list based off of party affiliation has made a big difference in being able to do that, and developing tailored messaging for those segments has been very powerful. In terms of missed messages or messages that we wish we could get out there more, and we're starting to work on this, obviously as a patient advocacy organization, really focused on the importance of the medical leave aspect of paid family and medical leave. And working with the American Cancer Society, for example, which is starting a patient advocacy table around that issue. And really in our conversations with policy stakeholders, bringing that message to the table that we need to think about this, and goes back to what I was saying earlier about care across the lifespan. Or to think about it as care across the lifespan, medical leave needs to be a really crucial part of that conversation. So that's an area that we wish there was more of an emphasis on in the movement, but then also among key stakeholders. I mean, I've had many a conversation with committee staff really hammering home the medical leave aspect. And we're really excited now that there's a larger movement within the ecosystem talking about the medical leave piece of this. But I think that's going to be a really important element that we're going to need to get over the finish line that we've all been talking about, is weighing both those aspects of the family and the medical leave together.
Mm-hmm. I think I would add that one gap is still impacted communities at the grassroots, honestly. I think that there's still, it's two different challenges. One is not even knowing your rights, period, and what you're eligible for or what you can access. But then on the other hand, the narrative we're trying to paint is this is a different future. This is a different normal that we aspire to. Wouldn't it be great if this was your right? Everyone has a right to care. And I think we haven't quite gotten the data on it, on how our communities think about these different issues. So I'm not even sure if there's like polling information, for example, on what Asian American communities think about care, for example, to help guide that messaging. And I do think that there's also a question, a longer term question about popular education and political education that's integrated into these discussions to hit that grassroots audience as well.
I had a question, if I'm not interrupting.
Oh, go right ahead.
Okay. It's taking it a little bit of a different direction, so stop me if this isn't the right room for that. But, you know, as a local funder, I spend most of my time working with our grantees, being out and about as much as safely possible, and developing relationships and hearing what things are going on. And I am wondering how, you know, with the Care Fund is a large national fund. And I think there's a way for local foundations to plug into the Care Fund in a way that then creates credibility on the ground with the folks that I'm working with, such that it helps to generate this communication and narrative shift. That when I'm in, for example, we have a Dementia Caregiver Alliance locally. That's a small group, 15 people, self-managed, no consultant. And as funders, they invite us all the time so they can kind of pitch us their ideas and we can talk about how we work together. And in those spaces, you know, bringing up these efforts that we're a part of and helping to see that credibility and helping to connect the dots. And so I'm just wondering, you know, how do the local foundations and philanthropy participate in this large, huge effort in a way, you know, we don't have $500,000 for 3 years to give as part of the requirements of the fund. But we could give, you know, $25,000 a year for 3 years. And we could then take that information, or not even being a funder, you know, that's, I think that way because that's how the fund was first introduced to me. But, you know, even just when I am in these spaces, how do I participate as a local funder, and how do I bring this into our community such that it then creates this cultural shift with those that I'm working with?
Yeah, that's such a great question. And I would love to engage with you offline more, because I know we won't have time to like hash it all out here. I think the idea of figuring out how we do aligned funding well and how we really connect the dots as philanthropy between national, state, local is critical. I mean, we say it all the time. We recognize it as critical to the ecosystems of our grantees. We recognize the need for coordination from the local all the way up to national. And I'm not sure that we always do it as well ourselves. So we welcome that conversation, Emily, and would love to connect with you later on that.
Yeah, I would love that.
Yeah, and I would just throw out, you know, I think that matchmaking, like Emily, I'd love to connect about this Dementia Alliance that you have locally, and how, from a storytelling perspective, I mean, I think there could be great connections and cross-pollination between the local work that they're doing and the national work that we're trying to do that will benefit, you know, local communities.
Thank you. Yeah, would love to connect.
Marcus, did you want to expand a little bit on your comment or feel like you covered it?
I think it's still there. It does seem to me that communications in and of itself as part of your multi-pronged strategy does offer a way for different organizations to enter in and be supportive. So I'm thinking about, I get real tactical, start thinking about, oh, well, if there are message talking points that are developed for your grantees around here, if there are toolkits and ways that we can utilize our communications to be on message around the care economy and these important priorities. And you got me thinking, I have lots of questions about resistance that I wish we could go into even further about how to break through around the pay-fors, that are coming ahead with some of these big legislative proposals. So just a plug to think about comms is one way for folks to be plugged in as we continue to think how we can also allocate resources and financial dollars to this as well.
Great, thank you for that. I think we have one more minute. Does anyone have anything that they want to throw out for the good of the order?
Sure. Because, step up, step back, and I'm really leaning into it. One thing that I just would caution us to all hold is the tension between a strategic communication, short-term communication approach and the research that folks that do narrative change and narrative power work increasingly are finding, which is what are those cued deservingness, what are those cued heuristics that we have unfortunately played into in order to appear centrist and to appear appeasing. And how do we lean away from sort of those short-term trade-offs in a strategic communications approach to a concerted approach for narrative change, which is going to require us to be a lot more coordinated and sophisticated, I think. So just something for us to hold and consider to think about.
Thanks for that. What a great way to end our breakout. Thank you all for your comments and your feedback, and looking forward to continuing this conversation. Enjoy, and you can go ahead and leave the breakout room whenever you're ready.
Thanks, everybody.
Thank you.
There we go. Okay, this meeting is now being recorded. So, so we didn't have a chance to do introductions around the room because there were so many people in the plenary, so that we are going to do some introductions now. So it would be great if you could say your name and your organization, your preferred pronouns, and just where you find yourself right now in the world. I'll start. I'm Anna Wadia, she, her pronouns, with the Future of Workers program at the Ford Foundation, and I'm in New York City. And I will pass it to Rachel.
I am Rachel Pine. I'm at the Altman Foundation in New York City. We're a local foundation, and I manage principally the health and related social services portfolio.
And Rachel, you can pass it on to somebody else.
Oh, Maria.
Hi, good morning for me. It's 11 in San Francisco, California. Maria Jandra is pronounced she and her. I'm part of UPlan, United Parent Leaders Network, and Parent Voices, San Francisco. I will pass it to Stephanie.
Hi, everyone. Good afternoon. I'm Stephanie Schmidt. I am with the Center for Law and Social Policy, or CLASP, in Washington, D.C., but I'm currently living in Annapolis, Maryland, not too far down the road, and I use she, her pronouns. I will pass it to Sarita.
Hi, everyone. I'm Sarita Gupta. I'm with the Future of Workers program at the Ford Foundation. And I am in Silver Spring, Maryland, just outside of DC as well. And I will pass it to Toby.
Hi, I'm Toby Punley, she, her, and I'm the graduate summer intern with the Irving Harris Foundation in Chicago, and recent graduate of the Erickson Institute in Child Development, so working with their EC policy team.
And would you like to pass it on to somebody?
I was just put it on mute when I remembered, and I'll pass it to Wendy.
Hi, everybody. Sorry, you caught me eating lunch. So I was off camera, but I wanted to say hi to everybody. I'll be off soon. My name is Wendy McQueenie. I'm with the Community Health Acceleration Partnership, where I focus on supporting a community-based workforce. And I use the she, her pronouns. And I'll pass it to, did you Ditha go yet, or Toby? Sorry, I was trying to look at my list.
Hi, I'm Udita.
Udita, thanks.
I'm Udita Srimushnam. I use she, her pronouns, and I serve as Director of Communications at Schusterman Family Philanthropies. And I'm really excited to be here with you all today. And I will pass it to Sade.
Yes, Sade. Sade Moonsami, she, her pronouns, Interim Executive Director with Family Values at Work, currently in Silver Spring, Maryland, and trying to find a quiet place because they just started construction in my apartment. So and on mute.
Great. Did everybody get a chance to
I
introduce
will
themselves?
pass it to Josie.
Josie.
Hi, everyone. Excited to be with you all today. My name is Josie Calapenny. I'm the Deputy Director at Family Values at Work. I use she, hers pronouns. And I don't know if Chandra or Savita, if you've gone, might be everybody, right? Okay.
I haven't gone yet. Thank you so much. My name is Chandra Matthews. I'm the Director of Programs at the Next 50 Initiative. We're an organization, private foundation based in Denver, Colorado, that we fund nationally, focused on aging initiatives, be that services or changing the way we think about and speak about older adults in the aging process. And oh, I think I got it all. I use she, her pronouns as well. Thank you.
Okay, I just wanted to share one logistical thing. Sade Moonsami, who you heard from this morning, was actually supposed to be in another group, which is why she just disappeared. Magic. So great. I think then everybody has introduced themselves. So so I wanted to, like we just said, I'm going to pose a couple of questions, but we really want this to be a conversation. And I thought I would turn to the funders in the room first. Many of you who chose this breakout group are, as you explained, funders that focus on a particular geography. And so you've probably had a lot of experience of policies, funding streams getting passed at the federal level, and then they come down to states or cities, and unless they are implemented well at that level, they don't actually reach the people that they were designed to reach. So I didn't know if any of you wanted to share any experiences you've had of that working well, or lessons that you've learned about how best to implement federal policy or federal funding at the state and local level.
So just a point of question to you. I don't know whether you plan to ask this question next, but obviously the role for local funders is not only going to be implementation, because that is still, frankly, even though we're motivated and high on the moment of opportunity, still a pipe dream.
Right.
So right now we've got an advocacy agenda and the question of local support for that part of what has to be done. So I don't know if you want to split those two into two questions.
Yeah, I mean, that is an incredibly good point. And actually, one of the other breakout groups is specifically focused on that, sort of local and state to national advocacy. So, so we absolutely agree that that's essential, and that's a lot of what we've been supporting. But we also carved out this space to talk specifically about the implementation work. And I would say that, as you know, every breakout room is being recorded. So we'd be glad to send you the recording of that breakout room as well.
Sounds good.
Okay, great. Any other thoughts on experiences with implementation?
Just to jump in with maybe an obvious one, but I work with we're a small foundation group of venture philanthropists. I'm doing a lot of work right now in New Jersey around supporting community-based workforce, doulas and community health workers. And one of the things we've noticed in working in the state of New Jersey, which has been really a terrific experience, amazing people, but just incredibly overworked and under-resourced. And so I think for us, it's been providing some of that nimble funding to actually build capacity, even within departments of health.
Right.
It's often the case that maybe eventually the money will come, certainly with ARPA, but we know that the processes states have to go through to hire can often take a very long time. And in the meantime, money is coming in, and to ensure that it's sort of properly absorbed and then deployed to the community-based organizations that we know we want to reach the most, we have just provided funding to hire, arms and legs, essentially, to work at state and local government. So I guess the catch-all phrase I would say is just capacity building at the state level.
Yep. Very good point.
One thing that I would raise, just sort of in the middle space between the point I made before and what you're saying about implementation, is that at the state and local level, we are also siloed between all the different care agendas. The group are different. They have different coalitions. They have different streams of funding. And to the extent that any federal solution flows through the state with leaving the state some discretion about what goes to who and how much, the whole fight to stay unified or not, how that plays out will come down a level to the state and hopefully to a city like New York as well.
Really good point. Really good point. And I wonder with that, if we could turn maybe Stephanie to you first, and thinking about. So Wendy, you mentioned the funds that are or may come down from the federal level. So there's already been $50 billion in the American Rescue Plan for childcare. There's almost $13 billion in the ARP for home and community-based services, and hopefully a lot more will be coming down. So thinking about, CLASP has done so much with local and state administrators. So I'm wondering if you could share, Stephanie, your thoughts on what needs to be done right now about ARP implementation, and what kinds of things you're planning when the American Families Plan and the American Jobs Plan passes, both in terms of the capacity that's needed for community-based organizations, but also state and local governments.
Yeah, I appreciate your positive forward outlook. I have the same one, planning for when. So I do think you're right. It's kind of this moment where we're trying to, what's the phrase, chew our gum and walk at the same time, to be able to implement the great resources, resources at levels that we've never seen in the childcare space before. And so while it is absolutely necessary and very much on the side of relief, it really does provide this tremendous opportunity for us to be able to be forward thinking, knowing or hoping and planning for when a future infrastructure big investment for childcare might happen. And so I think while we're certainly focused and trying to help states think about how meeting the urgent needs that developed as a result of the pandemic, we're also trying to be forward-looking with the relief dollars to think a lot about how do we invest to sort of eliminate some of the inequities that exist in this system? How do we rethink things so that moving forward, we're already laying the foundation for a big investment that we hope will come, soon in the reconciliation package. And so I think there are efforts happening with administrators. CLASP convenes administrators to talk through a lot of the issues that are arising, the difficulties, and getting the money out the door quickly to respond to need, but also being thoughtful about it and making sure that the implementation and the investments are what will move us forward. And so I think there's great work happening on the ground. I think the tension that we are seeing right now is the need at the federal level for stories and successes and wins on the ground and at the state level with the dollars, so that we can continue to make the case for the big investment at the federal level moving forward, but also the reality that it's just getting out the door and we don't have those stories yet to be able to send back up. And I think that makes the case for the importance, which I know is being talked about in other groups, about the connection between the work that's happening on the ground and how that gets fed up back up to the federal level and vice versa.
Yep. Maria, I wonder if you could share from your community. Obviously in California, there's a lot of discussions about federal money and state money coming down to communities. What are some of the priorities in terms of implementation that you and the parents that you're working with are pressing for?
Yes, I want to start by saying that we have worked really, really hard to kind of educate all of our members. And the first thing is that we started telling them what was this plan, what was this gonna look for them, right? And because that was the key for us to kind of spread the word. There's so many parents that do not know about all these resources available for them, right? And many of them have questions as well, but they don't know where to ask. I was one of them. I remember I joined Parent Voices thinking that they were gonna give me childcare, right? With the idea of, oh, they're gonna do all the help for me. But what I found when I joined, it was the opposite. It was like they were giving me the resources. How do I can access to all these other network of variety of needs that my family had in that moment. Now, what we are continue doing is that education about what does this American Rescue Plan is going to look like. And for example, just to give you an example, we've been holding a lot of virtual trainings, right, about what is included in the ARP, and families voted what they wanted to see, like bring their own solutions. So instead of addressing it as a, here it is, what you need to do, we were addressing it like, what are solutions that you need right now? Kind of like what Stephanie was mentioning right now. And we also have been leading the fight to waive childcare co-payments for families, because that as a for me, for example, that's gonna mean that means is that I'm gonna have some extra money instead of me paying for those fees. We're gonna be able to keep those that money in my pocket starting this Thursday, and that I can use it to pay bills, rent, and the immediate economic relief also. It's gonna mean like a continuous services for the families.
Thank you so much.
That's the wonderful part that what we have been achieving.
Yep. Josie, I'd like to bring you into the conversation now. So you are now with Family Values at Work and very deeply engaged with paid leave. And of course, you come out of Caring Across Generations, where you worked on home and community-based services. So both of those, there's lots of potential on the horizon with the American Families Plan and the American Jobs Plan. So what are some of the things you think need to be in place that funders should be thinking about to be ready for implementation at the state and local level?
Yeah, so I think there's a few things that will be critical in being able to really move things forward. One of the things that was already raised is that the challenges that our groups like Caring Across Generations, Family Values at Work, Moms Rising, who for many years had some overlapping work and audiences, but for a while operated in a siloed way, are now coming together, learning how to work together, learning these models, learning how to really set a structure of national coalition, especially national organizations that have state networks. And this sort of parallel of at the ground where these tables are also separate, the organizations are also separate, and creating models and incentives where we're really bridging between movement spaces and coalition tables, because the underlying need and the people of impact are often the same, I think is is something that we're committed to, and I think will really need to happen and happen quickly at the state level. I will say the other thing in regards to siloing is at the state level, the folks that understand the budgetary process and the folks that do issues-based advocacy tend to be very, very separate groups.
Right.
And there is we have seen both a hunger between advocacy and organizers to understand what it means to get billions and millions of dollars at the state level, how to advocate internally in new spaces to them about how that money is allocated, where it's spent, and what it means for what that spending, what that spending needs to do and needs to be. So that bridging of sort of like an expertise of budget folks and an expertise of advocacy and organizing folks coming together, I think is one place that we have to pay very special attention to, and really bridge that gap in new and creative ways. And the last thing that I will just say is that I think the outcome is very the desired outcome for all of us is very clear. I think the pathways to get there have to be as numerous and as experimental as possible. We have partners whose on-ramp to talking about and really building a base around federal work is based on talking to people about the benefits that they're eligible for. So it doesn't start off by sounding like base building, but really starting off by sounding like community meetings for people to know their rights and to know the benefits that they're eligible for before activating and engaging people. On the other side, we've seen things like our partners holding vaccination clinics and, holding call lines for people to identify where they can get vaccines for their families for free and to get scheduled, and using that to sort of collect people and have a conversation about the care infrastructure that's really needed across families. And it's in those creative ways that we have to have flexible funding so that people can experiment, but also do what works best for the populations that they're reaching. It's a little bit uncomfortable, particularly as national organizations who are looking for trends and who are looking for what's working, to sort of look at a table that has 8 million different things happening, even if the desired outcome is the same. But it's also a really great opportunity to learn what messaging works, what activations work, and what activities work.
Thanks, Josie. I want to pick up on one of the things you said about the need for more coordination and alignment between the budget advocacy groups, sort of the tax and budget advocacy groups that tend to be more like in the state capitol, right? And the grassroots organizations who are the trusted messengers to get the word out about these programs. I'm wondering, folks on the phone, Chandra, I know in Colorado, obviously there's some really great groups on both ends of that spectrum. Is there any experience you've had with them working together well in terms of implementing, new funding streams that are coming down from the federal level?
Yeah, I think there's good examples of that. And I think I don't want to say it's kind of one of those forced marriages, right? Sometimes in that you have to work together to get someplace. And I think that once they realized it doesn't really have to be forced. We're working towards the same end, that it became a much more cohesive sort of effort. But what my experience has been, and I think one of the things that we continue to see, is that when those things start to get implemented, there's need for funding to kind of coordinate or organize those efforts and bring stakeholders together. And we get a lot of requests for things to do that, which is important. It's important for those efforts to be organized and for that thoughtfulness. But I think all of that, just continues to show how, the funding that comes down sometimes is not thoughtful in that way to really allow organizations or state entities to plan and prepare. It really is just about distributing funds. And so I think foundations like ours are always sort of hit up for funding to kind of do that coordination, which I think is important, and we're happy to play a role in that. And I think bringing all of those stakeholders together is important as well. So yeah, I think there's good examples of you know, of the various kind of sides to an issue coming together and working together. I think that that's definitely happened more in recent years than, you know, my experience has been historically, and I do think that that's very important.
Great, great. Does anybody else want to comment on that? And then I will pick up on what Maria put in the chat.
I would just say I agree with what Chandra just said. Like, I think there are those models in different states. But I was just thinking about Josie's point about these two different kinds of advocacy groups coming together, and then coupling that with the work that Stephanie and folks at CLASP do around agencies. And so like that's the other gap, is the relationship of advocates and agencies who are also implementing these policies. And I think there are probably, I imagine CLASP has seen some really good models of where there can be good partnerships built, because the other piece of this is implementation of the federal policy. Then there's the ongoing advocacy at the state level that is needed. And then there's the enforcement of the policies. And I'm thinking about so much of what we've learned from Family Values at Work and others in the paid leave space of like the importance in that case, engaging with local businesses and others in the implementation. And so there's this ecosystem that it feels like we really need to help support the, you know, coming together of, or at least be in relationship to each other around this. That I know as we're a national funder, but I know when I did local work, like we always were looking for the partnership from local funders to support that kind of weaving as well. So just wanted to name that.
Absolutely, absolutely. I just wanted to turn our attention to some discussion that's been going on in the chat that Maria and Stephanie put in the chat. And wondering, Maria and Stephanie, if you could actually share for this group, because they may not be as familiar, a little bit about the Child Care for Every Family's network, and then any thoughts you have about, I know that the network is doing both of the things that Rachel mentioned in the beginning, both working to make sure that the funds that are coming down now are well implemented, while also really putting a huge amount of energy in bringing the voices of parents and providers and other leaders to federal advocacy. So I wonder if you might want to comment on how those are being woven together.
Do you want to start, Maria? Or you want me to start?
You can start.
Okay, great. So I'm happy to start. So I first just want to say the Child Care for Every Family Network, I feel like, is a good answer to a lot of the things that folks have been raising in terms of coordination and building, to your point, Sarita, like the ecosystem. I feel like that's a great analogy for like what the network really is striving to be, you know, something that sort of feeds off one another and builds off one another and really works towards one ultimate goal together. And so for folks who aren't as familiar with the Child Care for Every Family Network, it's a group of folks who well, hopefully a very large group of folks in the end, who are coming together to move transformative childcare work forward, seeking a big transformative investment in the childcare space. And it's really, to Maria's point in the chat, about building power and being led by the voices of parents and providers and their needs at the forefront of what's happening and what we're advocating for. And if you sort of envision multiple circles within one another, you can see the different components that are contributing to the larger ecosystem. So you have a core group of what we're calling the coordinating committee, which is made up of half state organizations and half national organizations, with provider and parents serving on the coordinating committee. And then provider and parent constituency groups, which are really driving the network and what we're advocating for, essentially. And then members and allies who can come to the table and really be a part of building that power together can participate in the working groups, which include a state and federal group with a state implementation subgroup for anyone here who's particularly interested in that piece of things, a research group, and a base building group, and one more that I'm not remembering off the top of my head, maybe a narrative group.
Narrative, yeah.
Thank you. And so we are just getting off the ground formally, although the organizations who've been working to build this very thoughtfully over time have been doing so for over a year at this point. And the Care Fund is one of our first funders for the network as well. So we're able to put money behind the building and support the parents and providers who are coming to the table to really bring their meaningful engagement in a way that's not tokenizing their expertise. So Maria, I'll let you add on anything you want to about the network, and happy to answer any questions as well.
Yes, and kind of just following what Stephanie was mentioning, we have been doing a lot of changes on the local, but haven't been happening anything on the federal level. So on the local, we've been working on educating the members, and now parents and providers are working together. We're advocating for better wages for providers. So now we need resources to create something similar on the federal level and learn the key moments of the timeline to know when we need to act as well. We need to get more parent leaders and have them, participating on all these conversations, bring what they need. We need to be shifting that narrative about this is what you have to do towards to what is needed. And I think the childcare for every family network is going to work perfectly. Now we're not going to be in competition with one or the other ones, right? And that's what we have seen. It's very achievable for us. We now working with the providers. I want to make sure my provider is getting taken care of in order for her to continue have opening spaces for my son. And so working together, have more like a coordinated ambition. I think it's gonna get us further than what we have been working on all these decades. We continue fighting for the same, but we are achieving little by little. In 5 years since I started, when I was in my second trimester and I started doing this advocacy work, I have seen so much advancement. So I'm very happy and proud, and looking forward to see more of the grassroots organizations working together.
Thank you, Maria. Thank you. And one thing you mentioned that is so key, and I think is really quite distinctive in the work that you plan and the network is doing on the childcare side, and then that's also starting to happen on the home and community-based services side, is this alliance between, in the case of childcare parents and then providers, childcare providers, owners of childcare centers, as well as the mostly women who work in those centers. So and then on the home and community-based services side, between people with disability and older people and the direct care workers. So, so I think that is really part of what is unique about the moment that we're in right now. And I don't know if any of you want to comment on that, and thinking again specifically about implementation. To what extent should networks of childcare providers, for example, or home healthcare agencies, that are often thought of as employers, but in a lot of ways are also squeezed by our lack of resources. How are you engaging them, or how should they be more engaged in implementation?
And just to add to this, it doesn't answer your question fairly, but just thinking more, I really liked Maria's points about like coordination, and then you're using the word alliance, and just recognizing potential alliances even with others in the public health jobs group too.
Right.
Like similarly around the ARPA funding, we're doing a lot of work right now with SEIU and others around prevailing wages. And I do think I'm trying to, it was a longer discussion, but rather than having separate conversations, right, while a lot of the ink is still drying on the ARPA regulations, how do we insert more language around the importance of prevailing wages, benefits, minimum wages, while that's getting sent to the states, not so that we're not doing it separately for healthcare, separately for childcare, separately. So would love to think about ways. I'm happy to share with this group. We worked with SEIU and others to do at least a memo of the importance of this and benefits for the public health jobs now. So if it's instructive for this work too,
please.
I recreate the wheel.
Yeah, that would actually be amazing. If you could send that to me, then I'll make sure that we get it around to the group. Thank you so much. That'd be great. And Josie, I think you wanted to jump in here, and you have 2 minutes, and then we will be whisked away.
All right, I'll try to do it in 45 seconds. One of the superpowers, I think, particularly of regional funders, is the power to be conveners. We're often in spaces where actually the advocacy organizations get shut out of trying to connect with agencies because there have been moments in advocacy where it's been adversarial. So you will find leaders in agencies and who are running Medicaid programs, who are no longer, where it just takes more work to reopen up dialogue. And that's actually a critical role, particularly that regional funders can play in this moment where there's a new window of opportunity, right? So bringing together those very agency leads that will be responsible for implementation. And the last thing I'll say is that there is a lot of misunderstanding about what is possible and what's not possible. So sometimes we're hearing from agencies that what they need is money, and they haven't heard that money is coming down. And then we're hearing that actually there isn't the infrastructure to even move the money, right? So there are these like really nuanced and wonky conversations that someone needs to play a neutral convener and bringing together parties that, 5 years ago were adversarial because whatever, the advocacy issue was of the moment that put folks in opposite ends. It's sort of like, the enemy of yesterday is the friend of today, but there's like a facilitator that needs to play a role in that, and regional funders can really play that role.
That is a great point. All right, well, we have just about 10 seconds left, so I will use 10 seconds to thank everybody for participating in this discussion and offering your thoughts, and look forward.
Are we all back?
Welcome back.
Great. I'm Brooke Kelly Green. I'm one of the co-chairs along with Anna and Aaron of the Care Fund. Want to thank you all for sticking around, for being part of the breakout sessions. I know ours was really excellent. We gained a lot of helpful insights. We want to leave time for any feedback. I think we have time for maybe 3 or 4 questions, or really to share something new that you learned today that you're going to be taking with you into your work going forward. We'd love to hear from you all. I can start us out if nobody wants to go. I'm going to share 2 things. That's how generous I'm going to be right now, from the brilliant women in our case that were giving us feedback as funders. Number one, we really heard that it's incredibly important for us as funders to flank all the folks doing this work because so many are women and women of color and are being undermined in the way that happens in any sector. And so the more that we can really lift up the work, legitimize it for the really kind of genius visionary work that it is, the better. And number 2, something interesting that came out of our call is if you have the capacity as a donor, if you work with families, family foundations, now is the time to really have your folks you know, doing individual calls and really just letting people know that they care. And that's another way to support this work. And, you know, given that we have such a diverse number of types of donors and foundations as part of the fund, we're really able to kind of call on all different types of educational means to do our work and to really flank the grantees that we support. I'd love to hear from anybody else who has anything that they'd like to share back from their breakouts. Maria, I think you had something. Do you want to share that with the group?
Yes, definitely. I would like to say it was a great conversation, and we all just come to the idea of how important it is to educate the members, how important it is to educate the parents. Me being a member with Parent Voices and U Plan, I have learned so much of resources that I have available that my family can really benefit it. And I have benefited from many, many of them that if I start talking to you, it will be amazing, because from when I started 5 years ago that my son was a baby, now that he's 5 and now I have access to a subsidy. But how does that look like? It looks on the education that U Plan and Parent Voices have invested on me, you know, and now I'm able to come to all these conversations and really talk about what's really needed in my community, but also how does that look on the federal level. And now we can work more on the coordination with other organizations as well. So thank you so much for this opportunity, and look forward to see more of these advancements, and until we get to a point where all families are really included, not just some of them, and we start also removing all these other barriers for families of color especially.
Maria, thank you so much. Emily, I see that you had a comment. Do you want to share that with the Zoom group?
Yeah, sure. Just one of my takeaways is that as a local funder, place-based, I really appreciate the breadth of a network and the ability to kind of share resources and expand our thinking here, and then help to leverage that at a local level. So I hope we can continue participating in this way. I really like this forum, and some of it's you don't know what you don't know. So this is really powerful.
Thanks. Anybody else want to share one last takeaway from the breakouts or from the meeting as a whole?
I can share from our breakout, which was focused on strategic communications, and just something that I heard loud and clear is that as funders, when we fund strategic communications, narrative change work, we need to recognize all of the efforts and the capacity that goes into that, and that it's not just a sort of one-off building a website or developing talking points. It's really about being able to support the capacity of an organization to conduct their outreach to their community and to really take and own and hold those stories that they're being given with trust and safety, and then be able to develop all of the other technical and strategic pieces of it, as well as potentially bring in outside professional support in the shape of a consultant or a strategic communications firm. And I just think that as we're thinking about and developing grants, to keep that front and center and recognize all of the pieces that go into really having an effective and trauma-informed communications approach.
Thank you. Really interesting reflections, Erin. And some of those same things came up in our breakout. So I wonder if there's some common themes across. We'll compare notes. As we close out, I want to make sure to give a special thanks to Julie Cashin and Pooja for supporting us in developing the content and substance of this meeting, as well as Anthony, Matt, and Albert from the Ford Foundation for ensuring that we all had what we needed to participate fully in our virtual space today. Thank you so much to each of you. For our current partners, we will be in touch about our upcoming planning meetings and our plans for another docket towards the end of the year. And for the other donor colleagues on Zoom today, please be in touch with any of the fund's co-chairs, myself, Erin, Anna, any of us or all of us with questions you have about the fund, how we can work together and support your work and support all of this incredible work. We also want you to know that over the next several months, we'll be doing some planning work and determining our priorities for the next several years. This is long-term work, and we know that. Although our first grants have been rapid response, we will, eventually be doing very long-term thinking around this. And there'll be some deliberate thinking about both the state and local strategy, whether we want to focus on particular states or regions and how we align and coordinate that with local funders in those areas. So for funders on this call today with any specific geographic focus, we'll definitely keep you updated on our discussions. And we want to keep everyone informed of the ongoing learning opportunities and any other ways that we can follow up from today's call. So we want to thank you again. This is a really vital learning environment, I think, for all of us. I want to really thank the grantees for taking time out of the important work that you're doing to talk with us today, educate us, and let us know what's working and what we could do more of. So huge thanks to everybody. We hope you have a wonderful week. It's a nice way to start out the week. And take care, everybody. Bye. Are we all back?
Welcome back.
Great. I'm Brooke Kelly Green. I'm one of the co-chairs along with Anna and Erin of the CARE Fund. Want to thank you all for sticking around, for being part of the breakout sessions. I know ours was really excellent. We gained a lot of helpful insights. We want to leave time for any feedback. I think we have time for maybe 3 or 4 questions, or really to share something new that you learned today that you're going to be taking with you into your work going forward. We'd love to hear from you all. I can start us out if nobody wants to go. I'm going to share 2 things. That's how generous I'm going to be right now from the brilliant women in our case that were giving us feedback as funders. Number one, we really heard that it's incredibly important for us as funders to flank all the folks doing this work because so many are women and women of color and are being undermined in the way that happens in any sector. And so the more that we can really lift up the work, legitimize it for the really kind of genius visionary work that it is, the better. And number 2, something interesting that came out of our call is if you have the capacity as a donor, if you work with families, family foundations, now is the time to really have your folks, doing individual calls and really just letting people know that they care. And that's another way to support this work. And, given that we have such a diverse number of types of donors and foundations as part of the fund, we're really able to kind of call on all different types of educational means to do our work and to really flank the grantees that we support. I'd love to hear from anybody else who has anything that they'd like to share back from their breakouts. Maria, I think you had something. Do you want to share that with the group?
Yes, definitely. I would like to say it was a great conversation, and we all just come to the idea of how important it is to educate the members, how important it is to educate the parents. Me being a member with Parent Voices and New Plan, I have learned so much of resources that I have available that my family can really benefit it. And I have benefited from many, many of them that if I start talking to you, it will be amazing, because from when I started 5 years ago that my son was a baby, now that he's 5 and now I have access to a subsidy. But how does that look like? It looks on the education that you plan and Parent Voices have invested on me, and now I'm able to come to all these conversations and really talk about what's really needed in my community, but also how does that look on the federal level. And now we can work more on the coordination with other organizations as well. So thank you so much for this opportunity, and look forward to see more of these advancements, and until we get to a point where all families are really included, not just some of them, and we start also removing all these other barriers for families of color especially.
Maria, thank you so much. Emily, I see that you had a comment. Do you want to share that with the Zoom group?
Yeah, sure. Just one of my takeaways is that as a local funder, place-based, I really appreciate the breadth of a network and the ability to kind of share resources and expand our thinking here, and then help to leverage that at a local level. So I hope we can continue participating in this way. I really like this forum, and some of it's you don't know what you don't know. So this is really powerful.
Thanks. Anybody else want to share one last takeaway from the breakouts or from the meeting as a whole?
I can share from our breakout, which was focused on strategic communications, and just something that I heard loud and clear is that as funders, when we fund strategic communications, narrative change work, we need to recognize all of the efforts and the capacity that goes into that, and that it's not just a sort of one-off building a website or developing talking points. It's really about being able to support the capacity of an organization to conduct their outreach to their community and to really take and own and hold those stories that they're being given with trust and safety, and then be able to develop all of the other technical and strategic pieces of it, as well as potentially bring in outside professional support in the shape of a consultant or a strategic communications firm. And I just think that as we're thinking about and developing grants, to keep that front and center and recognize all of the pieces that go into really having an effective and trauma-informed communications approach.
Thank you. Really interesting reflections, Erin. And some of those same things came up in our breakout. So I wonder if there's some common themes across. We'll compare notes. As we close out, I want to make sure to give a special thanks to Julie Cashin and Pooja for supporting us in developing the content and substance of this meeting, as well as Anthony, Matt, and Albert from the Ford Foundation for ensuring that we all had what we needed to participate fully in our virtual space today. Thank you so much to each of you. For our current partners, we will be in touch about our upcoming planning meetings and our plans for another docket towards the end of the year. And for the other donor colleagues on Zoom today, please be in touch with any of the fund's co-chairs, myself, Erin, Anna, any of us or all of us with questions you have about the fund, how we can work together and support your work and support all of this incredible work. We also want you to know that over the next several months, we'll be doing some planning work and determining our priorities for the next several years. This is long-term work, and we know that. Although our first grants have been rapid response, we will, eventually be doing very long-term thinking around this. And there'll be some deliberate thinking about both the state and local strategy, whether we want to focus on particular states or regions and how we align and coordinate that with local funders in those areas. So for funders on this call today with any specific geographic focus, we'll definitely keep you updated on our discussions. And we want to keep everyone informed of the ongoing learning opportunities and any other ways that we can follow up from today's call. So we want to thank you again. This is a really vital learning environment, I think, for all of us. I want to really thank the grantees for taking time out of the important work that you're doing to talk with us today, educate us, and let us know what's working and what we could do more of. So huge thanks to everybody. We hope you have a wonderful week. It's a nice way to start out the week, and take care, everybody.